technical people, the doctors, the lab technicians, the biomedical engineers, our guests, everybody is welcome. The Association of Doctors, we are so happy to see you here. As is limited, I am here to give a brief background about Kalu and also a brief background about our training. We are here for a medical course. You'll all agree with me that medical investigation is very critical in patient management. That is the starting point, and this is the purpose of our training here today. We have a critical point of discussion. It is exceedingly interesting. I think it is the first of its kind in this country. It is a technology that will know us. We can't wait to have a presentation from the team. We really say thank you to RIMA. RIMA East Africa, these are our principals present in Uganda, and they take over 6 or 7 countries within the region, including the recently introduced South Sudan. They are so excited to be here. We have a team of 7, a team of 6. They'll be introduced by Madame Susan. They have made it here. We have had presentations where the principals are online. They don't come, or if they come, it is only one representative. But here we are, we have a whole team of 6 members. I don't know. The reason why I keep saying 7, because I came along with them, so we are saying we are 7. So don't say he doesn't know. No, we are 7 as we are coming. So we really thank you so much. Just a brief introduction about Kalu Pharmaceutical Company Limited. We are established in 2021, immediately after COVID. I know it was so hard for a business to start at that time. But we say when it comes to health, we don't look at profits, we look at saving lives. So in 2021, Kalu Pharmaceutical Company was born. Some of you could have heard it for the first time, but we have been here for the last 3 years, and our mission is to supply assorted medical supplies, including equipment. We equip hospitals, we have laboratory equipment and reagents, we have pharmaceuticals, and we are present here in South Sudan. We have our showroom on just here at Malikia. Exactly. So this is our mission. Sorry, I need to be inside. Just briefly, this is our mission: to provide quality services. It has become normal. But it is something that we have come to address from the team, because these are unique points of investigation. We understand all that we have the tests for this H. pylori. We can always do a test, but the big question is, after the test, what happens? And these are the discussions that we're going to have. The aiding equipment, all the walking devices, the hearing devices, which we call the hearing aid. We have everything that goes in line with the aiding equipment for our differently abled brothers and sisters. We have pharmaceuticals as well, and we also have surgical instruments. I think I'll end my presentation here. I request that it ends here. We have a profile. It will be moving around. It's very important to know about Kalu. I would like to request Susan to come and also give a brief about RIMA East Africa, just briefly, as we deep dive into the presentation for the day. I really thank you so much. I wish you a very pleasant training. Thank you so much.
You're all welcome. Thank you for honoring our invitation. I'm Naidaga Susan. I head the marketing department at RIMA East Africa Limited. RIMA was incorporated in 2008. That means close to 16 or 17 years in business. We work as a team. We have a message from the human resource manager. However, the managing director is called Mr. Igamicha Ibaliwanda. He's the son of the father of twins. In our land there, we call him Salongo. And the mother of twins is called Nalongo. So So she's Nalu Sriviaiga, the Human Resource Manager. We have a message from her. We'll be hearing it. I don't want to take a lot of time because we are going to talk a lot. So let me allow my colleagues to introduce themselves and what they do at REMA.
Thank you so much. We are very glad to have you here today. All protocol observed. My name is Bizu Sekome. I'm a REMA East Africa and a pharmacist. We are very glad at the opportunity.
My name is Nachinki Namatolo. In REMA, I work as sales and marketing.
My name is Manu Timot. I'm a medical engineer at REMA East Africa. We do different activities, repairs, installation of different equipment, and other maintenance. So I'm great that you're here. We are going to receive all the services from us.
So you're a biomedical engineer. Exactly.
Manuel Sengova is my name. Good morning, South Sudan champions of medical.
I thought you were saying the other champion, that no, it is the champion of the Uganda.
So, I'm also championing the biomedical engineering in REMA East Africa Limited. We have brought you the healthcare technology only. We love you. Thank you.
Greetings to you all. Raymond, Ivanju is my name. At REMA East Africa, I'm part of the sales and marketing team. Thank you.
And my colleagues, you can go back, take your seats, mingle with your brothers and sisters. Right now, you're Sudanese. I've baptized you. Just in the next few minutes.
Okay, I think the clip is a bit having a technical issue. We shall deep dive into the training. But before break, we shall have to get that clip presented here. In the interest of time, let's start. We shall introduce the Kalu team after the training. Thank you so much.
Sengova, I'm in mechatronics and a biomedical engineer by profession. When I'm standing before the medics, I only speak healthcare technology because our profession is to bridge that gap between the technology, the equipment you see, the machines you see, and the patient's life. Okay? So, in case there is something missing, in case there is that gap that is missing, for the medics here to use such kind of technology, here is our profession, and we are here to bridge that gap. Thanks be to the representative in South Sudan, that is Kalu. Thank you so much to be our frontliners this side. We promise that we are going to be very good background players. Okay? REMA East Africa Limited is a company based in Uganda, but it has played all over East Africa. Right now, one is holding each other's hand. Kalu is holding our hands and bringing us to South Sudan. Okay? So, our presence is going to be fully based here. Any questions, anytime, we shall be available. Next. Yes, before us, you are seeing two equipments. This. Okay? Their names, they are Helicobacter pylori analyzers. Helicobacter pylori analyzers. Now, if I say H. pylori, I'm omitting the Helicobacter. The pylori is the real core we are rotating around as the medics this morning. And the analyzer is the work of the machine. So we are analyzing the H. pylori in our patients, in our bodies, and at the end of the day, we will come up with the results of which they will help us to recommend which kind of medication. And that term is called diagnosis, okay? You're welcome. Our dear visitors, please, if you are careful enough and answer some of the questions I'll ask you, I'll do the same, the way Susan has done. But in return, prepare your questions. If I'm just speeding, note it down somewhere, and then we shall have an exchange. I'm prepared to receive your gifts. Be prepared to receive my gifts. So, back to our point. Around East Africa, this is our major equipment that we are going to be looking at most. Reason being, this will play the best in our environment, okay? So this one is available, and this is available. This is the latter, this is the former technology that was upgraded to this, but we have another technology which is this, and which might be having limitations for our environment. So, for us, we are zeroing on this device, okay? The Helicobacter urea breath test, HUBT 20P, that's just a model name. It should not confuse you, but it's what we are focusing on. Now, this is a device that was invented due to the trend of ulcers that was rising out from far back in early 90s, and it was growing across towards 2000. Now, this is a machine that was invented to take a massive diagnosis, or we could call it a study, to get to know the reason as to why there is development of gastric cancer in the populations, okay? And that was a study that was done by several countries with the WHO involved. Our pharmacists in the next presentations will show you the links and the source of the information. So, the HUBT 20P is a device that you are looking at, okay? The device that you will have finally in your facilities. Briefly, we can see the green dots, that's the distribution of the HUBT 20, and this is somehow far back in 2018, but what I believe now, we have very many dots around in the globe, okay? The red dot, that's where our manufacturer, Headway, is based in China, and that's where the technology emerged from. Here we are. All right. Our business territory, the way Martin said, we are covering East Africa with South Sudan being one of the member, and Uganda, Tanzania, Rwanda, Burundi, DRC, we are there, okay? So, but in Uganda, we are basically at those hospitals, Nakasero, Dr. Plaza, Dr. Biansi, Zambia, Victoria, Uganda Matters, Hospital Rubaga, Abel, Imidila, Medipa, Lifelink, and these ones, okay? The technology is already in use. And at the end of this presentation, we will see whether it is really very important to have it or not, okay? Simply, this technology is using the diagnosis of active carbon or radioactive carbon, okay? But how do we do it? We want to see whether someone is having H. pylori within the gut, but we are using a machine to diagnose, but I would call it wirelessly. But how do we create the bridge between the patient and the device? Here is the way out. I think I'll stand in this position to avoid locking. Okay. Besides the machine that you just previously looked at, we have a cap or a capsule that is having carbon 14 in it. In the factory or normally in the environment, we have carbon existing naturally. A lot of carbon in the environment. But what they do at the factory, they collect that carbon and punch it. We call it punching, that's the technology, to make it carbon 12. Into chemistry, when you go into the electronic configuration, you only remove 2 electrons and then you make it carbon 14. Sorry, you punch it to have more protons and it becomes carbon 14 from carbon 12. What is existing naturally is carbon 12. The one you see in the environment, the one that we are breathing in, a lot of carbon dioxide, that carbon on it is carbon 12. So, at the factory we are making that carbon 12, we are punching it to make it carbon 14. Now the carbon 14 has a nucleus that is radioactive. It is producing a small trace of radiations, okay? Then they burn that capital into powder, and we call that powder urea. Okay? It will be a component of urea. So we are taking that cap or the capsule or urea. Let's call it the urea capsule. Okay? But it's having carbon 14, not the carbon 12. We know that we are used to the urea of carbon 12, but this is the urea of carbon 14, which is having small traces of radioactivity. So after taking it with water, we sit for 15 minutes. That is to allow digestion. We are breaking it down to open the cap such that it saturates into the gut. While it is saturating, it is interacting with Helicobacter pylori. We will see what happens. Then afterwards, for you are given another mouthpiece where you are pumping a breath. After pumping in a breath for 3 minutes, you take that card that is collecting your breath and you insert it into the machine. Hence the name urea, breath, test, analyzer. Okay? Urea, breath, test, analyzer. Where is urea coming from? May I see someone's hand? Where is urea coming from? Susan, do your work. Okay. The name urea, breath, test, analyzer. Okay? So that's how we are coming. Then after pushing the card into the machine, you will get your results immediately because the machine will display the content of the count of the Helicobacter pylori in the gut. We are continuing. Hope everyone is following step by step. Okay? All right. What I was explaining, this is the content. We have drinking water here, and we have our cup being taken. This cup is elevated carbon from carbon 12 to carbon 14, the urea capsule, okay? It's being taken. But the content or the chemical formula, chemists who are in class will see this O radical, which is unstable, and we are seeing this with the double bond and O, and then the OH group. So, in presence of water, this will break down faster. Okay? That's why we are taking the cup with water. You will take it with the soda, something else will happen. Specifically, drinking water. Okay? Then, what happens into the gut is digestion. When digestion is happening, we are breaking down in the cup, the urea breath content in presence of water to the products. Okay? But now, in this situation, when you have the H. pylori, that will act as the catalyst. Okay? It will only facilitate the breakdown. Without that catalyst, the process will be inhibited, will be so slow and may not happen sometimes. Okay? That's why we are following the time. There is a time element in our procedure. So you take the cup with water, wait for 15 minutes. After 15 minutes, start blowing into the breath card. After 3 minutes, get the breath card, take it to the machine. Are you hearing the element of time? Okay? So now, when you have the H. pylori into the gut now, okay, we have the chemistry happening, disintegration of the urea, and then it is giving out the content. Okay? When urea is broken down, we'll have carbon going into the blood streams, absorption into the gut. So the blood streams, we know that blood is finally moving to the heart and finally to the lungs to pick oxygen. When you are breathing in the oxygen, okay, I'll not go into the content that you are breathing in, but I'll concentrate on the oxygen that we are breathing in, the 21%, okay? And we are breathing out carbon dioxide. Right now, what we are breathing out is the carbon dioxide of carbon 12, okay? But after taking this cup, and you have the H. pylori, after the 15 minutes of digestion, you'll be breathing out the carbon dioxide of carbon 14. Have you seen how carbon 14 has joined the tube? Instead of carbon 12, you are breathing out carbon 14. But our carbon 14 is producing small traces of radiations. Okay? Then, are we seeing our patient is blowing into the correction card? Now, this is a different mode of a card, but it is similar to what we have. Please, Bill, open this. Okay, this is the sample correction card. This is how it is. It is only missing one thing. It's called a mouthpiece. Okay? At the end of the day, if Susan allows us, we will open up one. Okay? We will open it later when we go into application. Okay. Just as I was saying, you have removed the cap. Where is the cap? Do you have one? Okay. It will be in a package, like for the normal capsule, the strips that we buy. Okay? You only get one, be it a kid, be it an adult. It doesn't matter. You only get one. This is not the dose. We are only introducing something we are going to use to trace the activity of H. pylori. Okay? So you only get one, and that one is having this ammonia content, the CO content, and this. Okay? It's introduced into the gut when there is that H. pylori. We are seeing that part of the content is joining the blood streams, okay? And then part of it is getting eliminated through the normal formula, passing out to the fecal materials, okay? Yes, when you go for the other short stroke long core. Now, the longer core happens here. The short core goes here. You're seeing how this goes to the bladder, and we pass it as urine. We pass it out as urine. That's the ammonia content of this urea. And now, this unstable hydrocarbon content goes into the blood, okay? Ready to break down to release this carbon 14 into the lung. That exchange happens at the alveoli, okay? Now, when I'm bringing out the carbon 14 into this sample correction card that I've just showed you, and then finally, the doctor is able to put it into the analyzer, and then the analyzer will be tracing the radioactivity content into your breath that has been corrected, and it will give you the equivalent count of the Helicobacter pylori that is present into the bloodstream now, not into the gut. Okay? What crossed over to the bloodstreams? But whatever that crossed over to the bloodstreams, okay, is facilitated by the H. pylori. Meaning that when you don't have this, most of it will pass down, okay, and it will get eliminated. It will not be broken down into its products. Are you following? Okay. When you have this with you, this is the only thing I want you to look at on this slide. We have the urea capsule. You are taking it with water in presence of urease. Now, all we know that the urease exists as a normal flow into the gut, but at a moderate level. Now, that urease, it is the urease produced by the H. pylori that acts as the catalyst. The H. pylori is only producing the catalyst. It's not the one acting as the catalyst directly, but wherever H. pylori is, it is releasing the urease. And it is that urease that is a chemical compound that acts as a catalyst to break down the urea cap to get ammonia and carbon dioxide. Have we followed the chemistry very well? Okay? Someone is nodding their head. Please, can you, just briefly, can you take us through the time content, gentlemen? Rise up, please. The time content. All we have is?
This is the carbon 14.
Which is the urea capsule, in the urea capsule, and? Okay, in presence of? Where is urease coming from? Now what we have is? How do we eliminate ammonia from the body? Yes. And then the carbon dioxide continues to? Oh my God. Thank you. Please do your work. All right. Now, we are in the lab. Hopefully this kind of images, if we have the lab champions here who normally collect our samples. You are familiar with these pictures. Now, what we have got a number of technologies that have been existing. We have the histology, okay? We have the rapid urease test kits. They are already in the market, and then we have the culture, okay? So we want to look at this versus the technology that we have on the plate, okay? Not forgetting that those are invasive tests. Not forgetting that those are invasive tests. But from my description, I did not go invasive in any way. I did not interfere with the patient, okay? Meaning that if you had a kid, he could be as well playing out with a balloon by blowing the air into it. Afterwards, you collect that balloon from that pediatric, and then you have your sample. The only tag over will be taking the cap. Okay, let's go to the next. Now, the non-invasive ones, all we have is the serum antibody, we have the stool antigen, and then we have the HUBT, urea breath test. And that's where our technology is rotating around. Okay? So the other one was the non-invasive side, and this is the invasive side. Which one is VIP technology? Let's go on. All right. Just previously onto this slide, we are seeing the technology that we are using here, and then you see how one of our patients is blowing the air into the breath correction card. We'll rotate this sample around when it comes to application. Okay, I would like just to get someone. If you go to a lab and you have all these options available before you, and you are Kalu pricked, and then the lab attendant gives you options, or I don't know how the doctor recommends options, okay, that we have this kind of test, we want this kind of test, but we have option 1, option 2, option 3, okay. We have our, you are the patient. Amongst all, which one would you think about first? If you have one of collecting the breath only and taking the cup, you have another one where you'll be sent with a container into some small office where you'll have to struggle collecting the sample and you bring it to the doctor while you want even to cover your face. You have another one where you have to give in your hand the extract and sample. You have another one where endoscopy has to be inserted into your gut for diagnosis, okay? I'm talking about all those technologies to see what is happening in the gut. Which one would we go for first? Yes, please.
Thank you. Basing on your explanation,
Yes.
me as a patient, I think I'll take the HUBT because it has no much procedures whereby, like serum antibody, you need to undergo some sample collection, and then for the stool, you need to be given a container, you go. But this one here is just some few minutes, and then you'll be done, like 3 minutes collection of the sample.
You see? Now, I'm not speaking this out of bias. Everyone has that within his heart. You have the right answer, not so? Please clap for him. Before you do it, you first warm. Eat. Okay? 3 we go. Finally, you give him flowers like this. Okay? All right. So, I'll consider my technology VIP. It doesn't matter whether you're going to apply to an ordinary person or the member of parliament. I'll consider it VIP. Tag your price on it. You're making money, but there is comfort and you're saving money. That's our major reason why we are here. Okay? Alright. I will just bring a bigger simulation of that Helicobacter, such that it really sticks into your mind how it happens. Where does the rays come from? I'm considering the whole of this to be our Helicobacter pylori, the whole of it. Though it is existing as a microorganism, but what is the content inside is the rays. That's where our technology is rotating around. Okay? Now, the RUT, they are based on the pH of this, caused by this and this. Okay? Ammonia and the carbon dioxide, again from the urates. Then, histology is not around this and culture. Then, when we go to serum, we are looking for urates. When we go to stool, okay, we are looking at urates. Then the HUBT is only looking at the byproducts of urates. Okay? So it's rotating about urates. Now someone is going to ask me that urates is existing as a natural flora into the gut. And we are focusing at the urates. This is the reason. The urates produced by the H. pylori is kind of different and is so specific to the urea, to the carbon 14 that we are giving you in the cup. Okay? The natural flora acts, but is not that catalyst that facilitates the breakdown of the content. Are you following me? So, where you have the natural flora, whether you have that little urease content, when we are getting results, we have a count below which you are negative, and you have a count above which you are positive. So whether you have the natural flow that is existing into the gut, it is not effective enough to cause the count to go beyond the positive line, above the positive line. So the benchmark is 50. Okay? When you're 40 and below, you are negative, but there is that count of 0 to 40. And then you are 60 and above, you are positive. Okay? So, that benchmark, we have the urease, but it is existing as a natural flora, and it is not acting on our urea contained in the cup, because the cup is having the carbon 14 content. Hope I have shaded that with white, okay? So it's not confuse you. That's why I had to bring all this. Okay, ladies and gentlemen. Okay, before I was saying VIP technology versus the ordinary technology, we are moving towards the point. But there is this part of reliability of our technology. If you are only collecting this, the way it's as if you are praying out with something, it is easy to correct a sample, but let's check its authenticity, the reliability. The lab champions here in the house, they love to hear this word, sensitivity and specificity. Okay? I can hear some yes. Yes, how I wish that yes was near me and I was able to identify where it is coming from. I would do something. But the rapid urease test, its sensitivity is between 75 and 98. I want you to pay attention to this range. Between 75 and 98. Okay? Someone would look at the 98 and focuses on the 98, leaving alone the 75. And that span in between, when you get 98, subtract 75, that difference. Okay? And then the specificity, check the difference. Okay? Now, come to culture. We have between 70 and 92. This is research that has been done by WHO and the rest of the modalities. Okay? It's research that has been done. It's not research that was produced by the head with our manufacturer, but this is research currently available or even on internet. Okay? So, when you check this range, is big. But when it comes to specificity on culture, it is 100%. Meaning that you either yes or no. On specificity, it is very specific. But sensitivity is a wider range. Okay? Come to histology. Yes, it is a bit tight and it is a bit tight. Between 93 to 99, 95 to 99. Yes, let's cross over to the non-invasive because all of these were invasive. But the non-invasive, we have the stool, which ranges from 89 to 96 as the sensitivity. Specificity from 87 to 94. Okay? You are likely to scoop a sample, or the patient is likely to bring you a sample that was coming from part of the chapati. I was going to say commando. Do you know chapati? Do you know that what tau chapati? Yes. Okay. Now, imagine someone is scooping a very big, a smaller sample out of a very big sample space. Now, those are the irregularities that come with the stool. When you go to the to serology, same thing is happening. If you can see the span around between the two, along sensitivity and specificity. Now, if you are diagonizing for something, you would really want to go to that specific area and you get what you want. See whether it's there or not. Okay? That's the trick around diagnosis. If you are taking an X-ray, for example, the patient is describing pain, I would say along this left side, okay? And someone is giving you an X-ray covering from here up to here. So you are increasing, like if it was zooming, you would want to zoom up to that specific area where the patient is complaining, okay, and you take an investigation. So this is what we are looking at on sensitivity and specificity. So when you go to this stage, I want to speak about it last because I want you to have thought all through. Now the sensitivity is between 95 to 99. It is not 100%. Between 95 to 99. Then that was sensitivity. Specificity is between 95 to 99. Do you check the span around? Do you get the difference between the two? You are now zooming in. If you are taking like a picture, but you want specifically that pole, the nature or the texture of that pole, you are zooming into the pole, though it is covered on this wall. Okay? You are zooming into it, and you are studying the details of that specific zone. I'm just relating with an example. So, at the end of the day, we again have another reason to introduce to you the Helicobacter H. pylori technology, okay? We've got another reason, other reason. The first one, he gave us one reason. The other reason is coming into the picture. And this is, if it's medically, what you would recommend, what you would go for to ease your life, treat the patient and have the results, leave alone the profits, and have the results, you will choose. Thank you. Here we have very many. Of course, if you are doing like a massive study or something like immunization, and you are doing it like for Juba city, you want to collect very many samples, we will send you a machine like this. It is loading very many samples for patients, like 100 at the same time, analyzing and giving you different results. But what we have here is the 20 H2P, 20P. So here, the diagnosis. We have some little information to talk about into every department. I would not go so much into any of them, since we will share these slides. I don't want to speak against the current technology, but for sure, the fact is available. Okay? We all know that the rapid test kits, they are cheap and they are readily available from place to place. Okay? But this does not take away the fact that they are invasive. They sometimes require endoscopy. You're not able to give conclusive information without it. Okay? So, we have different technologies with the advantage and the disadvantages. Okay? But please allow me to talk about what we have here. I would say that it's the most reliable non-endoscopic test to document eradication of H. pylori, because you are able to take it when you see positively, recommend the medication. After a given period of time, he will talk about it. Return back to the hospital, take again, have the diagnosis. It will be able to show you whether the patient is improving or not. So, in the eradication process, you are able to track down, leave alone the diagnosis, but even in the eradication process, you are able to trace the performance of the improvement. I don't know the right medical term, but the performance of the patient. Is he improving or not? Okay? I would leave this for him to talk about it, but please allow me to break it down, such that when he starts, it will be very easy for you. Now, how or why are we going to this? Because everyone is complaining that it used to be only the patients with age 18 and above who are complaining about ulcers, not the young generation. But why? What causes ulcers? What has brought ulcers into the pediatrics? Okay? Everyone, ulcers. Everyone is complaining about ulcers. If you would take a diagnosis amongst us, I don't want to talk about what will be the results. But this starts as when you're normal, like me. Sorry. If you're normal, this is what you're having. Even if you are normal, due to the lifestyle you're living, due to what you are going through, you are likely to get ulcers. Okay? If you start starving yourself beyond the normal limits, if it's not intentional, like fasting for our friends who are Muslims, but they have a of controlling it as well, okay? But you are starving yourself, you are going in the theater, having procedure against procedure, procedure after procedure, procedure after procedure. You're not even reserving time to take something, okay? You are likely to develop ulcers. It's not something that it comes like magic and then it attacks you, okay? It is something that will develop out of the things, out of the behavior you're zeroing at. My friend here, for him, he's so much against taking the painkillers. He was telling me that painkillers are the primary causes of ulcers. To me, I knew that when you zero so much on taking food that is creating an acidity environment, makes the mucosa lining of the gut, that mucosa, to reduce into the size. That acidity reduces its size. Okay? That's where we are encouraging our patients to take vegetables to fight that acidity. You never find a medic recommending take some chips and chicken, and at the end of the day we'll be fine, okay? But we only force it ourselves because we want that taste. We want to live that life. We want to have that good thing, okay, from the taste. But we are not paying attention to our gut, okay? Once that acidity environment is created, the mucosa, where the H. pylori embeds, it stays into that mucosa. When you take that food that is causing an acidity environment, that mucosa reduces in size, and at the end of the day, that's how we call it, the lining of the gut will be exposed to the mechanical movements of the particles that you are taking in. Sometimes you don't even give attention to chewing up to 100%, and then the digestive system has to help you crush most of the big particles that you left in the food piece. And then the other lining is exposed to the food particle, and it is pounding it, that peristalsis movement of the digestive system. At the end of the day, you develop the wound slowly. The acidity is acting, and the peristaltic mechanical movements are acting, and then the other chemistry, whatever is coming into the play. There are several other reasons. I know you have some reasons as why ulcer is coming. Others say we don't know the reasons yet because it is getting too much, okay? But whatever it is, it starts when you are normal. Then you start developing chronic superficial gastritis. At this level, you are able to advance to the next level if you don't change, or if you don't go for diagnosis and it is eradicated, if the situation is reversed. But you are able, when if you cross over to chronic atrophic gastritis, you are able to go back. However, treatment is questionable. You are able to improve your eating habits, the food you are eating, the medication you are taking, the life that you are living, but at this level, yes, you can recover and go back to the initial one, or you will advance to the intestinal metaplasia. When you reach this level, you're only surviving on medication, but the process, all the pneumomucosa and the mucosa of the gut will not, the gut lining will not be restored to this normal level. Once you cross over to intestinal metaplasia, the way, then from this level, if medication is not handled very well, you go to atypical hyperplasia, and then finally you end up at gastric cancer. Okay? This is how cancer of the gut comes from. Now, with the diagnosis, when you have the proper diagnosis at early stages, I would say around this. Okay? Around these stages. That's why we are putting this. Please, it's where we are recommending that this patient should be diagnosed. You arrest the situation before it explodes. Okay? Here, we are only treating an explosion. We are only containing the impact of the explosion. Here, the explosion has affected everything. So this is a study that has been done, and the trend is rising. Me myself speaking, I'm positive, but I'm fighting to go back to negative. Okay? I don't know what went wrong, but maybe I was working somewhere, I forgot to take lunch, I was enjoying chicken somewhere, I enjoyed that acidic food. I'm positive, but I'm fighting to go back to negative. Symptoms are no longer coming. Okay? So that's what but we would want that to happen to our patients. If you identify yourself positive, let's look for a way of bringing him back to negative. Let that patient know that please don't go to these local herbs. Look for the best solution, because this will develop into this. Not in a way of scaring the patient, but in a way of delivering the right information of what will happen to the patient. Okay? So please allow me to take you to this slide, that at the end of the day, the gastric cancer, the chronic gastritis, the gastric mold, the gastric cancer, the dyspepsia, the duodenal ulcers, those are the conditions that you are looking at that the patient who has crossed the limit will be having. Okay? So this is the reason why our test is relevant. You get the reason why? So, in the clinical lab, is where this machine will be formed. It can be used in the endoscopy center. Once it is used and you find the patient negative, but is still complaining that, but I'm feeling this into the stomach. But when you take this test, the test is negative. That situation is existing and it is explained about give you answers why. Then that's why you will go to use the endoscopy machine, because for it is seeing physically what is happening onto the gut lining. That's why hospitals with endoscopy will need this machine. Now I'm talking about it in a business sense. Okay? When you have the endoscopy department, you are required to have the rare breath test analyzer. Before you cross over to the endoscopy, you want to really confirm, is this patient negative or positive? Okay? And the technology that will give you the results will be the H. pylori, because for it is sensitive and its specificity is high. Okay? So, this is gastroenterology department, and it will be required. Even in the pediatric section or department in the hospital, it will be required, because if you arrest the situation at this early stage, when you are at this stage like this, there will be no more complaints. You will be know how to manage it yourself. At the end of the day, this technology is non-invasive, it is reliable, it is convenient, it is simple, and it is swift. That's the information I got from him. I just transferred the exact information into this slide. If there is anyone who can challenge me to remove any of them, I'm okay. Yes, let's dive into the details. But from my presentation, from what I have seen and what I've been telling you, what we've been sharing together, the 5 are valid for this technology. It's non-invasive, reliable, convenient, simple, and swift. Imagine a kid is only blowing into something like a balloon and collecting a sample, okay? So, at the end of the day, someone is having a question. Who should be tested for H. pylori? Okay? Here we have patients. Someone will come complaining and or diagnosis or previous the patient's history is giving us part of this information. If you have like peptic ulcers, gastric mold, chronic gastritis, patients with family history, sometimes it is genetic. Yes, sometimes it is genetic. Then the longer term users of proton, it is what? Proton pump inhibitors. That is the PPI, not so. Sorry, I'm a biomedical engineer, I'm not into that. Okay, the endoscopic resection of early gastric cancer. Also, if someone has this on his history, okay, because we start treatment by interviewing the patient. How do you feel? What have you, something like that. So along the way, if you see his history, along his papers, what I have ever gone for this is what they found out, and you see this, you recommend the H. pylori test. Okay, patients with idiopathic, this word is so important. Okay, someone is having iron deficiency anemia with unknown causes, and if it's a patient wish to take that test, okay? You also consider all this. Now, it's going to give us more information about that medical part of, and then I know you have very many questions around this, but I know we are going to crush them, and we are going to discuss them among us, because if we don't know, someone else among us should be known. So, allow me to thank you very much. RIMA East Africa Limited is here for you through our partners, Kalu. My name is Emmanuel Sengova from RIMA East Africa Limited. Thank you for coming. At this point, if there are questions, don't tell me that you have understood everything. Someone should be having a question. Something should have come into your mind, okay?
If there is inhibitor, which is like antibiotic, they inhibit that in this break down the hormone and the cancer inside. That will not be
It will. I'll answer my question. Yes?
Thank you. Basically, according to your explanation, once we're considering this HUBT, basically, we're looking at the H. pylori producing the urease. But I think in the GIT, basically, where we are spanning, it's not the only
Place that
bacteria.
suffers.
No.
Yeah.
The bacteria that produces urease.
Can I first crash? Can we first go through this? Or we can collect more questions? Right. First of all, allow me to give you the procedures of how the test is taken. Here is what you have as a consumable. In addition to the machine, you have this sample collection card. This is where RIMA, this is where Kalu comes in to make money. This is where you come in to make money, okay? So this is the sample collection card that we will continue selling to you at a given price, of which you will tag on another price for your returns, okay? It has the mouthpiece Alright. Once my boss says, who am I to say no? When you tear like this, give it to a patient to remove it by his hands. He will feel so comfortable, and this spot is sterile, okay? When you touch it, he will not feel it so comfortable. But when you give it to him, he picks it like I'm the patient now. Then the doctor tears the sample correction card, instruct him to join the two through this wider part and this smaller part. One is inserted into the other, fix it and push it in very well. Okay? This is the procedure for joining it. But remember, before doing this, you first take that cap, which I'm not going to take now because it will waste a lot of time waiting and we don't have the machine to diagnose my results. So you take that cup with drinking water.
You can get a cup also. Is there?
Yeah, I can get a cup.
You can tear one.
Where?
Big.
The limitations were procedures you give, precautions to give to the patient. The quantity. The cup is one, the quantity of water. I wouldn't expect a patient to take these 500 mils at once. But once you take like 200 mils, 150 mils is okay. Something you can use to take medicine with, okay, is just enough to cause the breakdown of the cup, okay? And when the procedures to give to the patient. Now, after taking the cup, you wait with water, you wait for 15 minutes. After 15 minutes, tell the patient, please track yourself 15 minutes or have a timer yourself. Have somewhere. If you have very many patients, allow a time of 3 minutes or 4 minutes in between each of the patient, because they may bring all the cards at the same time, yet you have one machine, okay? So allow 4 minutes if you have like 5 patients waiting. Take 4 minutes, give the next a cup and drink water. Take 4 minutes, give the next one. Take 4 minutes, give the next one, okay? This will allow you that diagnosis time when the machine is processing for results. Now, after the 15 minutes, go through this procedure. Now, this cup is having a window. It is an orange one, as per now. It's a circular window. At this time, I'll allow let it start from here. Instruct the patient to keep on breathing in through the nose and blowing through the mouth. Even if you breathe in through the mouth, doesn't matter. But when you're breathing in, at least through the mouth, at least remove the cap out of the mouth, then breathe in, take it back, blow in. If you start breathing in through the mouth with the cap in, it will be as if what you are pushing into the card, again you are sucking it out. Okay? So make sure that what comes off the mouth into the card is coming out. If you are to breathe in, remove the card. If you instruct him to breathe in through the nose, it will give him time to only suck in and then blow out through the mouth. Okay? Now this happens for 3 minutes. You keep him breathing out for 3 minutes until, or if it's 2 minutes, if this changes to yellow within 2 minutes, you tell him or her to stop. If it doesn't change to yellow and he has been blowing into for 3 minutes, ask the patient to give you the card and take it to the machine and you insert it in. Please take me to the slide of the machine. Now this is where the card is being inserted. You only push it in. And then everything will be automatic. You only wait for results. Positive or negative. That will be all. Okay? Now, Before I give you this, before you push this into the machine, we have a protection sheet. This one, okay? This protection sheet, you have to remove it before you insert this into the machine. Reason being, this is protecting this, like the balloon-like cavella, it's like a bell thing, the pouch, the trapping pouch or the sample collection pouch, it's protecting it from mechanical damages of transportation, okay? Others, because they are packed together and it is shaking inside the pouch, you will find this already broken. So they put this protection cover to allow it protected during transportation. So you remove it from this side, and from this side it has a red symbol where you touch and plug it off, then insert into the machine. At this point, I'll give you that. Can please keep on passing it on as I'm speaking. Now, before doing anything, if you are to go for this procedure, I'm still answering your question. You have to interview your patient. Get the patient's history and the patient's health. How do you feel? What not? What before going for this test? This is what our manufacturers say. They are still in the struggle of testing how this capsule affects a pregnant woman. Does it cause miscarriage? Does it cause its hormonal changes? Does it affect the fetus? What? Zero results have been found. It has no effect to that pregnant mother. However, they don't want that pregnant mother to bring a basis that because of so and so, my baby is like this. Because of so and so, my baby is like this, okay? We don't want any miscarriage. We don't want any reason given the patient. Therefore, if the mother tells you that I'm expecting, okay, I'm carrying a baby, I don't know whether that is a baby, but if she tells you that I'm expecting, you excuse him from this. We don't want to give any reasons that this happened because I took a radioactive traces of urea. Okay? So, I think that crosses a bit to this side, but I'll keep on noting. Now, another thing, ask the patient, have you gone for this kind of medication? Or previously, in the last 1 month, in the last 2 months, have you been taking this kind of medication? He will give us the types of medication, but those medications that include the PPIs, have you been on such medication? Then you will know that my results might be negative. Okay? Because if someone has been on that kind of medication, that kind of medication might have eradicated the H. pylori or reduced the quantities. Okay? I'll call it the quantities, but the load of the H. pylori into the gut and along the gut line. Okay? So, get that patient's history. It is very important for you. Then, again, you will know that what will be the cause of this ulcers if it's there. You will know already. Again, the other question would be, okay, the other question would be, has that patient been taking alcohol? You see, the other one, I will not use it, but that strong one, that percentage eliminates H. pylori. I think it's one of the reasons why people go for it. They consider it medical somehow, but it only reduces that gut lining that the alcohol reduces the gut lining and exposes your gut to the action of the stomach. Okay? So ask that patient, because your results might be compromised. Have that history within you, because it will lead you to the other part of the other percentage that is remaining before sensitivity. The other, you remember, it is from 95 to 99. Now that part that is remaining for sensitivity, you have the reasons for it. It's not up to 100%. Then the other question would be, are you diabetic? Do you have any other cardiac what? The heart of the disease, I don't know how you call it. Yes. Then the other question would be, what's your history that you've gone for and they found that have you gotten any other history, medication history that you should be continuing? Like, for example, diabetic patients are supposed to take such and such kind of drugs continuously. Heart institute patients should be taking this drug and this drug and this drug continuously. The psycho-affected patients should be taking this drug monthly. You should have that history. And then compare the relationship of that history to the results that you are going to obtain, or to the restriction of this urea breath that you are going to talk about. Okay? Hope I have 100%. Susan, Bill, Timon, Liz, am I forgetting any other restriction before the patient carries out? Yes.
Yes, that patient also has not eaten for some hours.
Very correct. If he has eaten, at least let him wait for 2 hours before before the test. Okay? If he has taken breakfast, he has to wait for at least 2 hours. Reason being, we don't want to have a full stomach and then you are taking only 1 cup and then you are thinking about the 15 minutes, yet the 15 minutes will be wasted into pounding the other particles of food, not the what? Not the real carb. So if the patient has taken a meal, at least ask him to wait for 4 hours. Okay? Yes. Another one? Yes, please.
Does smoking affect the consumers?
Hey, Bill, that's smoking. He says yes. Because when you are smoking, you are taking at least please have the microphone.
Thank you so much for your question. Quick answer is yes, smoking affects the results of the test. In fact, it aggravates the ulcers. So if you're a smoker, then you have to quit smoking for at least 2 weeks before you conduct this test.
Does smoking affect the exchange or in the alveoli? It has. It affects. So now, do we expect our results to be affected like the exchange of the lungs, from the carbon from the lungs and the breath? Will it be having a different content or what? How? Please talk about it.
Alright. So this is what smoking do. Tobacco is a nicotine. It contains nicotine. This nicotine interacts with this test in such a way that it changes the morphology of the receiver.
What the card? Can you use this one? Yes. Is it for demonstration?
Let me just use this one. So when the patient is blowing into his card, it has a receiver which receives the breath that contains the carbon 14, which is from the respiration. Okay. So So nicotine will interact with this receiver and change its morphology. When nicotine changes the morphology of the receiver, then the receiver will not be able to retrieve the carbon 14. That's how.
Therefore, we should ask you that. The answer is, I'm going to the next question. Is there any other limitation that I'm leaving out, Tim? Another limitation? Yes, please.
Yes. So mine is just a question.
Oh.
If someone who is affected by kidney,
Yes.
it will affect the test, whatever.
TB. Affecting the counting. Is it affecting?
As a disease?
For the person affected with TB, quick answer no, it will not be affected. Reason because TB is caused by mycobacteria. The drugs that act on mycobacteria are not the drugs that act on H. pylori, much as they are all antibiotics. Thank you so much.
Great. I have a list of questions. They are noted. However, do not want to pause outside. Please allow me to start from there. Good enough, we captured all. Let's have a break. Thank you so much. I hand over this microphone briefly before we step out to our manager. Please, manager, come on.
Thank you so much. Clap for him one more time. Thank you so much for the, that was, I feel like I don't know. So we're going to have a tea break just outside here. On your left, you're going to see someone will direct you there. Enjoy your tea break. We are taking only 15 minutes. So
I hope you enjoyed it. So we are up for the second session, and we request that we do a round of introduction. We tactfully didn't do it earlier because we knew some brothers and sisters were not here. So we can do a round of introduction because we know part of these gatherings we have what we call relationship building. We interact and you never know where we'll meet again. So I'll pass on the microphone. Apart from the side of our special guests, I'll pass on the microphone from the other corner. We can move like this, introduce ourselves, and what we do and which facility we come from, just briefly. Thank you so much. I'll start with the gentleman directly here. We shall use the same microphone.
I want to say thanks once again. I want to say thank you for our brothers, our colleagues, our supporters from the FCA, Minister of Health, and other athletes. I really want to say thanks to those who are attend to share our future, our hopes, and our passions. Rima East Africa is one of the leading companies in Uganda and expanding in East Africa, and they have decided to be a part of us here, and we welcome them. Thank you very much. Thank you.
Thank you so much. Mr. Bruhani. Mr. Bruhani is one of the directors, the mind behind Kalu, and right now we are expanding to Rima and back to the people of South Sudan. This is a healthcare concern to everybody. What is being discussed here, at least everybody was been before a doctor. The doctor has told them, let's test for this. We thank you so much. Over to the moderator of the day so that you can take us through.
Thank you. Did an amazing job. So we're going to pick it up where we left. There are some questions you didn't answer. So if we can start from there, and then Mr. Bill Bruno will take over for the next session. Thank you.
Once again, welcome back from that live session. Hope everyone has been relieved. Nothing will happen to your gut, I assure you, after that beautiful session. All right, allow me to get back to my list of questions. Bill, send me that book as well. Okay, among this, what I noted, someone was requesting to know whether we have a negative implication if someone takes the tab and he is diabetic, he has a heart condition, or can we call it pressure? Yes. And any other in that line, if someone has been on medication, is there a negative implication on the health when you take this tab? First of all, what I explained is physics, though it is cutting across to chemistry, okay? All we are tracing is the ionization or the radioactivity, the dosage from the carbon-14. That dosage is so small, and actually it is less than the radiation that you are receiving from the gadgets around you. When you hold your phone, hold your anything else, you have a smartwatch, you have a PC around you, when you collect all the radiation dose that is coming from those gadgets around you, it's far much more greater than the millisieverts coming from this car. It is 0.05, okay? So, if you are considering radiation, this is not something that will be radioactive like the X-rays, the gamma, those active radiations that causes cancer. No. Now, someone is looking at urea, like the increase of urea in the blood, okay? The increase of that count into the blood. I think Bill is going to bring it out effectively, and he will rule out what is happening to such kind of conditions. Please, Bill, I hand over to you for this specific answer to add on what's the effect, that negative effect, if someone is diabetic, if someone has pressure.
Thank you so much. I would like to take on this question. In fact, I was expecting such a question, especially to do, because we are talking about urea, that means we cannot leave out or rule out the possibility of a patient coming in with a history of kidney failure. What happens? The patient has kidney failure, because we are talking about urea. All right, so the query is very simple. It has to do with what is actually the amount of urea that this person is intaking from the capsule. The amount of urea in the capsule is 70 milligrams, okay? 70 milligrams is the amount that this person is going to intake. 70 milligrams it can easily be handled by a patient even when they've had a history of kidney failure. They are not going to have any complications at all. That it can easily be removed from the body via urine and sweat. That urea can easily be removed from the body, of course, via ammonia. Okay? Yes, so there wouldn't be any issues whatsoever. Have I answered that?
Now, then when it crosses over to pressure or heart conditions?
Yes, heart conditions and pressure. So here we are looking at urea being mixed in blood, you know. So then you are having, so you're looking at things to do with increased pressure, just like how you can have salts in blood, okay, or any other substances in blood. They can increase pressure because we are looking at this urea is going to be drawing water from the body into the blood. So you're increasing blood volume and then you're increasing pressure. Isn't that right? Considering still the amount of urea, it will not be so. You will not have this amount of urea draw a lot of water from the body into the blood, increasing blood volume and therefore pressure. So the a patient with heart condition or anything else like that, there wouldn't be an effect. Thank you so much.
Thank you, Bill. That's the medical touch. Thank you so much. I just continue to, okay, the urease produced from other regions of the gut, because the gut starts from, is it so? Yes, anatomically the gut starts from the throat. If it is digestion, actually it starts from the fingertips. So if I come to the mouth, I start my gut down, up somewhere, up after that, duodenum, okay? So now, this research has been established and it's true. One of our professors who used this machine first from Nakasero Hospital, he was operated and his duodenum was removed. So from the stomach, you continue to the what? To the large intestine? What? To the next part, so the duodenum part. Yes. I don't know the medics, how you call that in the medical term, but it was removed. And wherever he goes, he was our, we call it the control. I had someone from quality control, but this patient was our control. He said, if I take this camp and I have positive results, I will tell you something. And if I'm negative, again, I will tell you something. Then he went for the test. He made it actually twice in the duration of 4 hours. He took the first one, he was totally negative. Even the count was below 20. After 4 hours, he did another test and it was also negative. And he told us, do you know why? He had used that technology and he intentionally wanted to prove that our technology is giving reliable results. I'm talking about quality control and what is happening along that gut, okay? At the end of the day, he told us that most of the urease is produced from the duodenum, that urease that is existing as a normal flora into the gut. Most of it is produced from the duodenum, okay? And because his duodenum was removed, it did not have any urease and did not give room for any Helicobacter pylori because he was on a medication previously, so it was supposed to be negative, okay? And he said, yes, this machine is reliable. Now, along the gut, different things happen. Also happen in different areas. But where it is tremendous, it is from the stomach downwards, there it is stomach. Upwards the stomach, the ulcers, that kind of ulcers. I don't know the medical term. Above the stomach, it is usually rare. Sometimes it is even mechanically created. With mechanical condition, external forces apply. For example, if someone takes a bigger particle, like if you take like a bone into a fish, and it creates an incision. Then when someone goes for endoscopy, if someone is in ICU and you're trying to open for the airway, such kind of conditions. I'm referring to those conditions as the mechanical conditions. So downwards, you have such. Now, if someone questions me that what about the urease produced from other regions? It would exist as a normal flora, first of all. 2, because the urease produced by the H. pylori is the one that is specific to this urea manufactured. It is manufactured intentional. So there is that configuration of the receptors or the configuration between the catalyst and what is acting on. Because there is that configuration, it will not act on the others which are existing as a normal flora. Therefore, the breakdown from other existing urease from other regions will not have an effect on our urea curve. Okay? Then, on the same note, someone asked a question that what about the other hydrocarbons come into the blood coming as a result of other activities? Was that a specific question? It came from this region specifically. Was it you?
think so.
Yes. Was it that question, first of all?
No, I would love to rephrase.
Okay, rephrase it, please.
Actually, what I was trying to mean, you agree with me that the urease we are talking about here, which catalyzes the hydrolysis of that carbon-14,
yes,
is not only produced by Helicobacter pylori, right? There are some other normal floras which produces the same urease. Now the question is, isn't there any possibility that someone may not be even having H. pylori, but is having these other normal floras, and they take action onto the same thing?
You are right, and it will happen. However, their action will not cause a count that is beyond the positive line. It will be below the negative line. That's why the benchmark is not 0, it is 50. You get my point? It is 50. Above 50, it is an action that is beyond what you are talking about. Beyond what you are looking at. The count of 50 is beyond what you are, is the benchmark. Below 50, at least let them they are acting and their count of the results. The results that are produced from the machine, it is a count. It's not the number of H. pylori, it's a count of ionizing radiations coming from this sample collected. Okay, so the count below 50 negative, but that count is there. Okay, but above 50, you are positive, and that number at least is contributed to the urease from the H. pylori. Yes. So the results, I just said that the count is what you are looking at. Unfortunately, I don't have any printout, but into the computer or into the machine. The machine is programmed to automatically generate an ID for the patient. However, the normal procedures, the SOPs that you have there, you normally feed in the patient's information by a computer. Okay? So, what the machine does, you are able to feed in the patient's ID, the patient's name, the age, and other details. You feed into the machine, into the computer. That machine has the software that you can program to have the heading of your hospital. Okay? That's like a letterhead. Then the rest of the information comes down. At the end of the information, it gives you a bar graph. With that bar graph, with a line. Above, when the bar graph exceeds that line, the count is above 50. And when the bar graph is below that line, the count is below 50. It does not stop there. It goes down and gives you the real count, that the count was, for example, 150. And it gives you a conclusion that positive. When the count is 20, 25, 39, 38, then it goes down and concludes on the same printout. It concludes negative. However, if you don't have a PC, the same machine has a small printer. It gives the patient's ID, the batch, and the results. The results, the count in number, and the conclusion, whether positive or negative. It's a small roll of paper that is usually attached to the hematology analyzers that you have and whatnot. So that's the results. Now, when you get the count, this count is not representing the severity of the condition you have into the gut. No. It's not directly proportional that the count is 1,000, you are too sick, you require to be admitted with immediate effect. No, and no. Reason being, I will say, not everyone having H. pylori, having ulcers will test positive. Quote my words right. Not everyone having ulcers will test positive. because of the other limitations, the question came advantage and disadvantages. For example, if someone was a very good consumer of alcohol, the stronger one, I don't know the percentage of the strongest one, but once you are a consumer, the H. pylori will be less into your gut. But that does not remove the fact that you have the wounds or the ulcers into the gut. You get my argument? For us, we are looking and targeting the H. pylori. We have introduced a condition that is affecting the H. pylori. H. pylori is running away, but it has left the effects, the wounds behind. So, when your gut is having the other mucosa, the lining, the H. pylori is embedded into. But you are taking the alcohol, you are removing and depleting that layer slowly by slowly, and you are exposing harsh conditions to the H. pylori, and it is flowing away, running away. So when you take this cup, you will not have the catalyst to break down the urease into its products. Therefore, into your brain, you will not have the results to cause the positiveness on the machine. Therefore, you'll be having ulcers and it will be saying negative. Therefore, not everyone is having ulcer that has H. pylori. If someone has been on treatment, like in that month, and you go for the test, you will not have the H. pylori because you are on treatment. The treatment, which is removing the Helicobacter pylori. Okay? He'll give us the details about it. Okay? But such conditions which are causing such information. Now, when you're analyzing the results, if someone is positive, take it that someone is positive and go for the medication. Do not equate the severity of the count to the condition of the patient. If you are positive 80, positive 100, positive 300, take that to be positive. Okay? At least this is like a screening level that takes you assurance that this patient is positive or this is negative. Okay? 2, not everyone that is positive that is having ulcers. I'm changing the statement. Not everyone that is positive that is having ulcers. Ulcers, we are looking at the wounds. But in the positive, we are looking at the count of that was caused by the H. pylori urease. Okay? Now, someone before you is not having any symptoms, is not complaining. Someone like me, I don't have any symptom, I don't have anything to do, any connection to do with ulcers. But when I was testing, I tested positive. What is it? Now, this is the condition. Not the condition of ulcers is not starting from ulcers. It starts slowly developing. Now, at other stages, the Helicobacter pylori is getting to be exposed and it is active, but it has not gone to the stage of developing the wounds. Therefore, you don't have any symptom, you don't have anything, you are testing positive, but there is nothing to do with a symptom or a pain or whatever symptoms coming from ulcers. You get my argument? So, I want us to deal with this technology having that background, that not every patient who is positive will be having ulcers. Therefore, when you take an interview onto the patient for the symptoms, that is very important. Because you cannot recommend this test before taking that background information from the patient. That will guide you that this patient, depending on this and this and this and this, let him go for this test. Hopefully I've covered that question, that analysis of the results. Okay? Finally, safety of the urea breath cup. He gave us the milligrams contained in the cup, the assurance, and I give you the millisieverts is actually 0.05 millisieverts. They cannot cause any effect onto your the nucleus. Our body, the composition, the atoms of our body cannot have any effect from that small dosage. It is a dosage that is existing in our normal background. Let it be communications masts, the phone that you are picking. Sometimes you even forget and it keeps on WhatsApping throughout the night when it is on low battery and it's the radiation increases. So whatever is in the background is much more than what you are getting from the car. Therefore, it is safe. That's about the safety. If it is the machine, someone would worry that how is this machine capturing the data? Am I safe when I'm neighboring this machine? This machine is only carrying sensors that only react when there is radiation. Okay? This is the reason why I'm saying that when you are putting it nearby a PC or any other equipment, first calibrate it such that it gets to know that whatever ionizing radiations I'm getting from the background is existing naturally. Okay? And therefore, disregard it. That's the reason for calibration. We calibrate that machine. Once you get one, we will show you the procedures. I won't go into the details when you don't have the machine. But when you put it here, I will do the calibration such that whatever is in this environment is considered to be zero. And whatever I will be getting from the sample card is only what I will receive. So it only has the sensors when it receives that ionizing radiations. That's what it converts into the digital figures that you are displayed on the screen and printed on the printer. Okay? So it is safe. It is safe. It's not something that you have to, where you have to put a protection, what? No. Then, finally, the advantages and the disadvantages. I think from wherever we've come from, we've been hitting on the limitation, this what, that what. That is the disadvantage part of the technology. And the advantages, I finished most of the advantages during the presentation. Now the disadvantages, maybe the pregnant mothers, you are not sure of what will happen. To the ionizing radiation, we have seen its safety. Though any ionizing radiation cannot be considered to be safe. However, what's its safetiness? Okay? So sometimes you, the medic, tell us that yes, the X-ray is harmful, but you weigh the reason as twice you are recommending someone for the X-ray versus the condition that is existing. Then you end up recommending for an X-ray. That is what we consider for this situation. And then you end up focusing on the results that you get that will cause a treatment that will be permanent than the other negative side. Maybe the other disadvantage, which is an advantage to some of us, we can focus on the profit making as well, which may not be an advantage to the patient, but an advantage to you. It may not be it may be a disadvantage to the patient when it's an advantage to you. It has that cost implication. It will not, something good does not come at. Yes. We will come in to do the calibration, you pay for the machine, you pay for the cards, and then the patient will come and give you money. After all, even if he comes for school, he will also pay. So let good things be tapped into them. Good things, that is money. I think I end my session here. Allow me only to say this. Rima East Africa Limited is not only looking at the urea breath analyzers, also other critical care equipment. those that are used in the ICU, fully anesthesia machines, ventilators, CPAPs, whatever that you want into the critical care. Let it be medical function, okay? The beds, ICU beds, whatever. Let it be lab, we are covered. Let it come to the critical care support in terms of medical gases, from oxygen, piped oxygen, oxygen plants that are producing oxygen, come to the patient care onto oxygen. Those are services that are delivering oxygen to the patient. Finally, to even the point of care that you need in the ICU, that is the, it's called the point of care machine. It's analyzing in an ICU, in a theater and ICU, it's the optomedical machine, it's a blood gas analyzer. It's giving you results instantly. It does not require the free refrigeration consumables, but it has only cartridges which are kept at room temperature, and you might need one for your ICU, for your critical patient care. Allow me to say thank you. I hand over the microphone to the manager, please. I think we will need to.
All right, thank you.
Okay, thank you. There's the one question only. In case the patient refuses to take the pill, and maybe I send for school, how are you going to use the machine for that test?
In case the patient refuses to take the cup, and then he wants stool, I think that patient has chosen a different technology. There is no way you can have results with this machine. I think no patient will ever refuse a medic instruction unless he has a reason. Yes, if someone wants to save the life, they will even go for the other invasive, painful procedure. But to answer your question directly, that patient might feel safer for the other technology other than this. Otherwise, for this, you have to take the cup. You only have to convince the patient, this has no effect. It's like the normal food that you eat, and there is urea in it. It's not going to take anything else. It's not going to cause any allergy. It is food. Then you will take it with water. It's not sour, it's not what, something like that. Thank you.
Thank you so much for that, sir. Now, on stage, I want to invite Senkole. Senkole, please, Bruno. Did I pronounce it right? Senkole. Yeah, I was told, Susan told me in Uganda you say it slowly. Yes. We have all the time. So it is Senkole. Welcome.
So I'm very glad to finally be presenting to you. We're going to be talking about the treatment of H.I.V. But before we dive into this topic, I would like to clarify something. That the capsule we're talking about capsule. It is not a drug at all. It is not a drug. So the reason why it's not a drug, it is not just marketing purposes or whatever. It is truly not a drug because it has no pharmacodynamic properties. You know, in pharmacy you have two things. You have pharmacodynamics and then you have pharmacokinetics. So the pharmacodynamics is what the drug is doing to the body. Okay? And then the pharmacokinetics is what the body is doing to the drug. So the capsule in HUBT is not a drug because it does not have pharmacodynamic properties. So if your patient maybe is afraid of taking these things, say, no, I don't want drugs, I don't want. Well, there is actually no clear means by which you can use to explain to them that it's not a drug, but for your own conscience, it is not.
And then also that's 70 milligrams. Does anyone of us here know the amount of urea that is toxic to the body? If you know the amount of urea toxic to the body, I have a very big package of that. Yes, sir.
Greater than 45.
Greater than 45, exactly. So you have a great, but the units, milligrams per deciliter, correct. So just to give us a sharp figure, it will be 60 milligrams per deciliter. How much are we intaking? We are intaking 70 milligrams out of how many liters of blood? 5, give or take 5, right? So we are looking at a very safe method of diagnosing H. pylori. Okay? So let us not be skeptical about the toxicity, about the safety, except the patient does not have kidneys at all. But if they have one kidney, it doesn't matter their history of kidney failure, it will work, and it will work perfectly without any consequences. So right away, let's dive into our presentation. So we are discussing the treatment of H. pylori. Is it right there? Is it okay there?
No, you are blocking someone.
I'm blocking some?
Yes.
I think I should start here. Okay. Yes. Thank you so much. All right. So in the management and treatment of H. pylori, we are having several drugs and we are having different regimens. We are using quite a lot of things to manage this particular pathogen. We should all recognize and conclude that H. pylori, first of all, exists as a normal flora in the body of every one of us here. But you can get an infection under two circumstances. When you ingest, let's say, food or substances that have been contaminated by H. pylori, active H. pylori, okay, you can get an infection. And if a person has a PUD, they can also be infected by H. pylori. This clarifies his two last statements that he was making, okay? So if you're having PUD, you're having these ulcerations inside your gut. So the normal flora is leaking out of your gut. You know, it's leaking out of the mucosal membrane into your gut, and then talking about the fact that the gut is acidic, it is a very conducive environment for the flourishing of the pathogen. So by that, you have an infection. So now, when you get the infection, what do we do? So we've conducted the breath test, we've conducted the stool test, everything. It is showing positive for H. pylori. What do we do to eradicate? Because what we are looking at is the total eradication of H. pylori from the gut. It is not supposed to be there at all, except under special circumstances like food, digestion, and all that. But it's not supposed to be there. So we are looking at eradicating it from the gut. And what we are going to look at first, we are looking at the key principles guiding the choice of the eradication therapy that you're going to use. Number one, you're going to consider the local audits of treatment outcomes. They are very useful. Local audits, do we all understand what I'm talking about? Yes. So you're going to look at your data. You're going to look at the number of patients that have been coming to your facility. 10 patients came to my facility having H. pylori. I gave them this regimen. I used this therapy on them. What were my outcomes? That means that the therapy worked or it doesn't work. So you find that out from your own data, okay? So the things that you're going to look out for, you're going to look out for resistance patterns. You're going to look out for resistance patterns, and some of the resistance patterns that we're having a resistance towards clarithromycin. Am I speaking terms that every one of us here is familiar with? Yes, I am. Thank you so much. So we are looking at, and in this instance, in this discussion, I'll be referring to the drug as because I'm going to use an acronym. If I'm talking about metronidazole, it will be MR. That means metronidazole resistance. If I'm talking about clarithromycin, it will be CR. Is that understandable? Let's continue. All right, so you're going to look at the resistance patterns. You're going to look at the dosage and duration of the therapy. You're going to look at there are factors that you cannot modify, you have control over. Such factors are the viruses of the pathogen. You don't have control over the viruses of the pathogen. It is existing now in your gut. The conditions there are conducive to it. You don't have control over it, okay? But you can take it down. And then you're going to look at this. Now, this is an enzyme. It exists in our liver, okay? This enzyme is what is responsible for modifying every kind of drug that you intake in your body. Most of them, not every kind, most of them. We have what you call there are 4 processes by which drugs are modified in the body. And one of them is metabolism. Metabolism, that means when you take paracetamol, for example, it does not exactly act as paracetamol. It is paracetamol in the shop, but not in your body. So the liver, using this enzyme, it is going to add or remove a few things and components from that particular paracetamol to make it active or inactive. This enzyme is what is responsible for doing that. So this enzyme exists in different forms. They are called polymorphs. That means we are talking about polymorphism. I'm using a lot of scientific terms, but I'm very confident that my audience can interpret. So we are looking at that enzyme CYP polymorphisms. So you don't have control over the polymorphism of this enzyme at all. So these are the unmodifiable factors that you should look at. And you're going to look at cost. You're going to look at the cost at which you're going to give this therapy to the patient. Of course, we are discussing business and science. So you have to look at the cost. Drugs should be, the other thing is that the drugs that you're going to use in the therapy should be on the essential drug list and widely available. The essential drug list is where your drug regulation board comes in. Widely available is where RIMA East Africa, Kalu Pharmaceuticals come in. Okay? So RIMA East Africa, Kalu Pharmaceuticals will make sure that this particular drug that you want to use in your therapy is available to you. And then the drug regulatory board will make sure that this drug is on the essential drug list. Sadly, I don't know about South Sudan, but in our country, the essential drug list has not been updated in about 4 years or so. So it is not exactly conducive. We are having the speed at which diseases and infections come in society. It should be matched. The energy should be matching with the speed at which drugs are legalized. Immediately this drug is seen to perform well, it should be legalized, and then you can go ahead and do the studies that accompany later on. But first of all, save the patient. There is no single drug that you're going to take that does not have a side effect. It does not exist. As a matter of fact, our major topic of today, which is H. pylori, one of its major causes is not hunger. It is drugs. And the drugs we are talking about here, they are the NSAIDs. Do we all here know NSAIDs? Non-steroidal anti-inflammatory drugs. These drugs, generically known as painkillers. I have headache, I have backache, I have whatever stomach. Let me take aspirin. Let me take indomethacin. I have, my joints are paining, everything. Let me take indomethacin. Let me take piroxicam. The more you take these drugs, the problem is that their mechanism of action, the way they perform, directly inhibits. We were talking about the mucosal membrane. The mucosal membrane is referred to as the mucosal membrane because it has a layer of a protein that is responsible for the manufacturing of mucus. We have mucus in your respiratory system and in your stomach. This mucus is what protects your mucosal membrane. So the problem with NSAIDs is that they inhibit directly the process by which this mucus is manufactured in your gut. So you don't have a problem with having a well where you get water from as long as the source of the water is not blocked. Is that it? So you are having this mucus is being degraded by the acids, but then you are taking NSAIDs which are directly blocking the manufacture of the mucus. What will happen? The layer of the mucus will continue to degrade. When the layer of the mucus continues to degrade, there is no replacement. It will eventually be eroded, and then the mucosal membrane will be exposed to what? To acid. When the mucosal membrane is exposed to acid, remember behind the mucosal membrane, you have a very, very dangerous living organism called the H. pylori. It lives there. It is normal to everyone else. So this acid will go ahead to erode now directly the mucosal membrane. Remember, the mucus is no longer there. And then when it erodes the mucosal membrane, it will create an ulceration, a wound. What happens is that you are going to have the H. pylori start leaking out from that wound into your gut. When it comes into your gut, it finds acid. When it finds acid, viruses, it will just multiply. When it multiplies, you get infected. When you get infected, the problem with H. pylori is that it will aggravate your ulcers, and then you end up having GERD, PUD, mouth, and then at the end of it all, you develop the cancer of the gut. That's how it works. H. pylori has been clarified and classified as one of the top cancer-causing agents. That means it is a carcinogen. So we are not looking at just X-rays or anything here. We are looking at a living organism that every one of us here has. So if you're not careful with your life, you are living with a living carcinogen in your gut. So you have to be careful. Take the tests. Don't just say the test is very expensive. Does anyone here of us know what it costs to treat a cancer patient? It does not cost $50,000. No, that's child play. It does not cost $100,000. That's child play. It costs a great deal. We are talking about $300,000 plus. This is what it costs. And the curation of the therapy that is used in management of cancer patients is amazing. I don't know what those guys are doing there, because it doesn't work. I mean, you just have your patient hair sweep off, the skin gone, everything gone. You're like, what am I doing? But this is the therapy that is available. So what do? Don't say the test is expensive. This is a test that is going to help you. This is a premium test. Why is it that today you are no longer using Nokia phone? You are now looking at Samsung, you're using iPhone. Is iPhone 100K? No, it's not 100K. But you're very comfortable because you know the value of an iPhone. It's as simple as that. When you know the value of something, number one, you go for it. Number two, you not abuse it. You know value and purpose. Okay? So let's continue kindly. Let's go. So the therapeutic choices. So we are going to look at the first line therapeutic choice. Now that you've already considered the key principles, that you've considered them, you checked your data, you've done everything. Now you want somewhere to start from. This is where you're going to start from, the first line. The first line, like every one of us knows here, the Pylori kit. Yes, you know the Pylori kit? The Pylori kit, personally, I've deemed this ineffective. I know it's not. But you have the PPI there, okay? This is a proton pump inhibitor. Why is it called a proton pump inhibitor? Doesn't every one of us know? The acid in your stomach is because of hydrogen. I mean, it's because of hydrochloric acid. Hydrochloric acid has hydrogen and chloride in it. Now, the hydrogen here is not a gas, but it is an ion. It is called a proton. That's why now when these ones, there is a system working in every one of us here in the stomach. It pumps hydrogen ions from the mucosal membrane into the gut. Okay? So it pumps it across that membrane. So when you intake food, that pump is activated. It pumps that hydrogen into your gut. So when that those ions are in your gut, then you can digest food. If they are not there, you will not digest food. You have other serious issues. So they are very important. But when you have ulcers, the same things that are helping you digest food, they become poison to you. So this is why we have PPIs. They inhibit that pump. Okay? That means there is no acid going to your gut, right? So you can see the effects of drugs. So you're having this thing, it's helping you, and yet you have to inhibit it for the greater good. Greater good. Okay? Then we are having amoxicillin. This is a penicillin. Okay? Many people have they are called allergies towards penicillins. Okay? But for the purpose of the greater good, you have to take the penicillin. Then we have clarithromycin. This is in pharmacy we call them beta-lactamase inhibitors, like that. So this is the triple therapy. It's called a triple therapy. It has 3 drugs in it. And this is what is majorly found in the Pylori kit that maybe some of you have already used, and you've seen that the Pylori kit is not working. So what did you do? You went to a herbalist. They told you this bottle is 100 whatever, maybe whatever dollars they charge you, and then you went and took the bottle. Till now, the bottle is not bottling at all. So what you have to do? You continue, come. We shall help you. We know these things better. The herbalists, they can have the generic knowledge. It's helpful. But this is the reason why we have science. Science is purity of everything you have in nature. We purify things in science, and then we give you the pure ingredient that will help you. That's why we have terms like active ingredient, NPI. You have your leaves, they have this drug in it, but that particular drug has a specific part that will work in that particular disease condition. That one is what we get. Put it in bigger quantities. So you have a lot of quantities of the active substance. What you have a drug that is effective and efficacious. Okay? So you are having, now every one of us is familiar with that. Number two, you have bismuth-based quadruple therapies. I don't know how many, has any one of us interacted with this one before? By show of hand? Have you? Not really. The reason, I know the reason. The reason is in the first line. We are looking at key principles. We say that you are going to have your drug regulatory authority update the essential drug lists and all that. You know. As a matter of fact, these drugs are all of them. None of them is not on the essential drug list. So why is it that in your own medical complex, whatever you call it, it's not there? Why is it not there? Probably you don't know that it's supposed to be there. Okay? Maybe you don't know. So now I'm telling you, this is the purpose for this discussion, that you may know that this drug has to be there because of what it does. So you have the bismuth-based quadruple therapy. This is a triple therapy, this is quadruple. That means it has 4 drugs in it. The drugs that are in it, you're having a PPI, you're having bismuth, you're having tetracycline, and you're having metronidazole. And then the regimen will be 10 to 14 days, and that will be 4 times a day. This regimen has an issue. The dosage is clumsy. How can you tell a patient to be taking things 4 times a day? What are you doing? Even food, we take 1, 2, 3 times a day. Food, very more important than drugs. We take 1, 2 times a day. So the quadruple therapy, much as it is effective, it has that clumsiness. You cannot tell a patient to be taking these things. The biggest challenge that we face in the pharmaceutical world, there are 2 things. We are having 2 things, but then they sum up into one. It's all called resistance, drug resistance. Drug resistance as a result of what? Self-medication and poor compliance. These are some of the things that lead to poor compliance. You cannot tell a person to start eating drugs as food. It does not come. Even if it were you the doctor that is prescribing, you take them fast. They will not kill you. Take them 1 week. You will not be comfortable. So this is why this is the challenge that may come with this quadruple therapy. This, for you to use this, you must have your data. Remember the principles. You must have your data that in your region you do not have MR. We all remember MR? Metronidazole resistance. You must check your data and find out that the people that you're treating, actually most of them they don't resist metronidazole. If they resist metronidazole, then you have to go to a higher ground. Something like, does anyone of us know? Lizard plasmodial, antiprotozoals. These ones majorly work on protozoals, metronidazole and the class. Tinidazole, they are all there. Okay? So, we are also having another one. You can substitute tetracycline with amoxicillin. These drugs are common in our medical facilities. They are common. But what we are discussing here is to help you. What do you combine with what to get what? This is what we're discussing. We're not discussing new things. So you can substitute amoxicillin with tetracycline in the quadruple therapy, not in the triple therapy. Okay? So you substitute this one, and that's what you get a PPI, you get bismuth, you get amoxicillin, and then you have metronidazole. That means if you are going to use tetracycline in the place of amoxicillin, it means this particular patient perhaps has penicillin allergy, is allergic to penicillin. So you cannot start giving them amoxicillin. Instead, you give them tetracycline. Okay? But you know the issue with this quadruple therapy. I've highlighted it. Okay? Then we have this is all first line, it's not second line. We have non-bismuth quadruple therapy. In this particular case, you don't have bismuth. Okay? You don't have bismuth. So you're going to have a PPI, Do we know some examples of PPIs? They are common.
Yeah.
Yes, we have omeprazole. You have esomeprazole, lansoprazole. All those ones. They are the examples of PPIs. Okay. Yes. So you are going to have a PPI. You are going to have amoxicillin. You have clarithromycin, and then you have metronidazole. In this one, you don't have bismuth. You only remove bismuth in your therapy if the people that you're going to treat, you checked your data and they do not resist clarithromycin. This one, okay? Low metronidazole resistance and low clarithromycin resistance. We go back to data. Correct. Let's continue. The next slide. So, I've personally interacted with pharmacies that use this drug, levofloxacin. I was talking to somebody and then they told me, no, you cannot start on such a higher drug. You know, yes, it's true. You cannot start with that because those are some of the things that bring about resistance. Okay. So you go back to your data. So you're not just starting from a higher drug. But you've tried some of these other things and they are not working. So what do? You want to help this patient. You go to levofloxacin triple therapy. So you're having a PPI, you're having amoxicillin, and then you're having levofloxacin 10 to 4 days. 10 to 14 days. This only works if your community does not have levofloxacin resistance. So you go back to your data. Make sure you check your data. I love data. I love data. I love numbers. I don't like a lot of words when it comes to science. I love numbers. Can we continue, please? Alright, so now let's go to the second line choices. The second line choices, you have bismuth quadruple therapy and levofloxacin triple therapy. Okay? So you've tried every other thing in the first line. So you're having the first line singles, and then you're having the second line marriage. Okay? So bismuth based, you're going to use it for 7 to 14 days, and then the levofloxacin based, you continue to use it for another maybe 3 days or so, okay? And then it will help this patient. This particular one, much as it has an eradication greater than 80%, this is not the reason why you're going to start using it. You bring problems in society, okay? You bring issues. When it comes to antimicrobial resistance, a very serious issue. The key principles that I highlighted to you earlier on, I just summarized them. There are about 20 of them. They are talking about 20 of them, about 17 of them talking about one thing, resistance. They just putting it in different words. But it was all resistance. The information that I'm giving to you here is on the website. You go to www.worldgastroenterologyorganization.org. It is there. It is there. It is actually a PDF. You can download it and get all the information that I'm talking. So it is not head generated. It is based on data that I personally have interacted with facilities that are using some of these therapies, and from the WHO and WGO. Where best can you get information regarding therapies to do with gastroenterology? Okay, so let's kindly continue, and I'll show it to you. I have some screenshots from the website. I can show them to you. So we are having, this is from the website, so you can see it. This is worldgastroenterology.org. It is there. It's a PDF, so you can go and search them out for your own self. So you're having the therapy, you're having a PPI. This is the common one. We all know. The one in the Pylori kit. It is this one, number 1. Very ineffective. I don't like it. But it is not ineffective for everybody. No, it is not. So you have to use your data and find out it can work, especially with children. It can work with children, you know. But for people that have had, let's say, PUD for quite a while, they've tried all these things and they are not working. Okay. And from my experience, I've got to realize that we have a certain class of drugs. I don't know if you've heard about it. It's called ulcer healing drugs. They help heal ulcers. So they don't just prevent acid to run into your stomach. They heal the ulcer. How many of you have them in your facilities? In your medical centers, you have ulcer healing drugs. They are there. a patient will come and then you give them this drug will heal ulcers. When it comes to healing ulcers, what do patients do? They go to herbal medicine. And what does herbal medicine does? It does not help them. So get these things. Kalu Pharmaceuticals Limited has these things. They are importers and distributors of these medicines. They have them guaranteed. Everything. Even this one that we are deeming ineffective, they have it because it's not effective for everybody. Okay? River East Africa Limited has these things. So make sure that you have them in your facilities. When it comes to health, this is one of the reasons why the most funded entity in society it is funded without profits and all, it's health. They said because when it comes to health, leave your calculation of expensive and inexpensive. That's it. You are either dying or living. It's not a matter of discussion. Okay? So we have in the application, this is widespread. Okay? It is widespread when CR is low. We all know CR right now, right? Then the success, major determinant in primary CR. So this is you use it only when clarithromycin resistance is low, and that is
in both the patient and the lab technician who's going to run the test, and that can lead to false positive and false negative results.
Just I want clarification because I'm confused. You brought up the issue of misoprostol, and we were talking about the treatment and the triple therapy. So I want to know, is it misoprostol a part of that one, or you just brought it as an example?
Thank you. In the lab or any other equipment, we need quality results. Does that machine have control? Thank you. Any other question?
Thank you. Bill, can you please analyze the people about what happens in the lab if you don't place the equipment into the lab? What are the conditions?
It has indeed been so successful. Mine is something very minor. Over time here we've been having a challenge that some companies have been coming up with such products, but when it comes to, I think my colleague, one of my fellow techs said about it, talked about it, that when it comes to like reagents, you find that by the time you go there, you find the reagents they are not there. So how, let me hope this one won't be the same case with others, because in most cases for us, it becomes so challenging that you have the machine and you have a demand, but the reagents which are needed to run or to meet the demand, they're out of place, and you end up losing clients. So another thing, I've seen here that Kalu is located at Medicaid. I'm not very so much well understand. I don't know where this Medicaid is, but supposing, I guess it's far from where I'm staying. I'm supposing. So, is there any, supposing I need that machine, what are the after-sales services you get? Thank you.
Was just saying, in similar scenario, you'll find a company coming with bringing products like this. You buy from them, at a certain period of time, it might get spoiled, and they don't have technicians to come and repair, then your product will just lay wasted. So hope Kalu has a technicians to repair in case of a technical issue. Thank you.
Temperature of the liquid Yes, the equipment.
So the equipment we talk about, that is HUBT. I would just like more light on it in terms of the product, the cost, and also the condition for quality. Thank you.
Answer that, then we'll take more questions.
Alright, thank you so much for your very thoughtful, wise questions. They really show that you are interested in this matter. It's an encouragement to us. Thank you. So I'll start with the simplest one. I may not go in order, 1 to whatever, but I'll start with the simplest one. The simplest one was something to do with confusion. What's about this misoprostol? You know, we are talking about triple therapy. Again, we are talking about misoprostol. Misoprostol is not part of the triple therapy. It's a standalone drug. You don't add anything, to it. It's a cytoprotective drug. It protects your mucosal, your mucosal layer. That's what it does. But it is not advised at all to be given to women of childbearing age, those that are pregnant. And in fact, its major use right now is in gynecology, but its first use was in the management of periods and GAD. So it is not part of the triple therapy. I answered you. Yes, right. So my colleague here, because of the two presenters, and as a matter of fact, we might even have another one to answer a few questions on the list from Kalu Pharmaceuticals Limited. If you can kindly, okay, yes, right. So if you can kindly come forward so that we share these things, they're very interesting.
All right. Why Martin is joining us, the issue of cost. Someone is worried about the cost. Availability. Those two things. Cost, availability. All I know that our driver within South Sudan is come and is gathering every information to cover that. Okay? Please let him have a word with you on that way.
Thank you so much. If I can jump, before I can get to the issue of the cost, I think there was a direct question about the after-sales services. This is a very good question, and it is a very key point of concern. Yes, equipment are introduced in the market, like the one you have at hand. After some time, equipment is acquired, but the consumables are nowhere, and it brings about frustration. This is what we have discussed as a team, and that's why we have put this as a project. We are taking it on as a project. It has a project manager, it has the implementing team, and we are going to work directly with the facilities, all of them. That's why we needed to get to know who and which facility has come. We are going to approach you, and these are some of the things that we're going to do. Of course, equipment acquisition will be number one, and we shall move into stock management. This is a model that has been applied in Uganda, and it has worked. Stock management is very critical. We sit with the procurement team and do what we call stock estimates, so that we know this is a cartridge that has 40 pieces. How many are used in a month? In 6 months, how many will be required? So that forecast is done, and always that stock is available. So the issue of stockouts in terms of consumables, it is something that will not happen. This I promise you, because we are taking on this as a project. This information is moving directly to the right ears of Susan, and I believe she's going to echo this when she comes to give a closing remark. But this is a challenge that has been in the country, and I thank you so much for addressing it, because we have seen it. Equipment come, equipment get wasted, frustration, and eventually the patients are the ones to suffer. Not so good. I believe we have business owners here. and that is not good. The return on investment is also affected. Another thing we shall do, biomedical services. We have a team of biomedical engineers, and also among the team that has come, we have biomedical engineers. This is one of the reasons why they have come, to connect to the team here for support. This is after sales services. This is a support program that we have also put in place. This is all a methodology continent that we have discussed as a team on how we are going to deliver this service. Of course, we have more trainings, like the way we have started now. The equipment is not in the country, but already the knowledge is in the country. By the time the equipment gets here, we all have an idea. That's why we have the right people in this building. We really thank you for coming and honoring this invitation. So, the training, we shall have an online training, and that's why you registered there. We shall have another online training in case you need more knowledge. That can be arranged. We shall communicate the dates. And we shall also have what we call customized training. One-on-one. If EB Clinic says, if EB Medical Center says we need a specific training about this, that will be arranged. So I'm using EB as an example, but all of us, if you need a very specific training, please reach out to us. It will be free, it will be online, and if need be, we can bring a trainer again to specifically handle your matter. Because as we say, we are taking on this as a project. We are looking at a public health challenge in the country, and we are ready to get a solution. That's why we are not only talking about the equipment, but we are also going ahead to talk about the therapy. Finally, I know in technology, there is what we call advancement. For any technology, there is advancement in technology. We used to have our cassettes. The people who are my age mates and above will remember the radio cassette. You remember that? Of course, we have the players. I don't know. Nobody is here for the players. We have the jukebox. That one has not come. They're at home. But here we have the cassettes. Right about now, I don't know which technology, but I think also the CDs have run out. You will find time, most of the computers that are coming, they don't have provision for what? A CD, they don't. So, technology advance as well in a situation where this machine has had a change in technology, we shall have the same team to come. So these are the after-sales services and support that we have aligned as team and Kalu and Rima to make sure that this works out well. Now, finally, it goes to the price. We shall communicate the price to the respective customers. After this, we shall come and sign up the memorandum of understanding with you and all that. Of course, the machine is not in the country. We cannot say that this machine will cost this much. It has to come. We have to put up the costings together and everything. But to assure you, it will be really affordable. And our principals have what we call a price ceiling. They say you cannot charge a customer beyond this because we want to make it affordable to everybody, including the final consumer of this machine, and that is our patient. I hope I've tried to answer the question, but this is exactly what we're going to do. I thank you so much.
Thank you, Martin. Let's give him flowers. Some more light to give. On the porch, just to give more light onto his, to put flesh on the bones that he has just presented to you. This cover has the date of manufacture and the expiry date. Just in case I can read it for you for stock management purposes. Okay? The date of manufacture is 2024, April 7th April of 2024, and the date of expiry specifically is on 6th April of 2026. Okay? Now, if I know that it's 2 years, you go into your data in the lab, check out the number of patients at least for a month, and there you are able to do the math for the 2 years. Okay? I will leave it at that for stock management, the way he was doing it. So we will give you a very good platform on how to do the stocking, and whatever. It is something that is not stored in special conditions. It is a cassette that is stored at room temperature. Okay? Maybe if it is, we have extremes once in a while, or you have a region that has extreme temperature, please do not keep it there. Just take it to room temperature. Meaning that there is no cost that you are actively there for storage. Okay? Then, same way, there is another question in that line. It is, that was storage temperature. For the machine, it is again stored in a lab environment. You normally have the AC in the lab. If it's not available, it should be at least at optimum temperature. That's in the lab, okay? That's the machine is okay for that environment. Even if there is no AC, it can still perform between 0 to 40 degrees, of which here we don't have 40 degrees. Eh? We have up to how many degrees? Okay, I will not deny, but still, if we could, we are going to read, once we get the machine, it will come with a manual, and you see that it is covered within that range, and it has no defect. Okay? Finally, onto this pouch. For every pouch that you have, it has the instructions of use. We don't want you to forget. Okay? Yes. Someone will be worried of, what if I forget the procedures? No, you will not forget. Now, I think also Martin will have to get back at some point and gives us the right directions of how to access Kalu. The directions that you move to this building, there, here. Okay? Please keep it right. Now, myself, Timothy here, I'm a medical engineers, and we have another engineering team in Uganda. I myself, I was factory trained. I know in and out of this technology. I know how to handle it. Even if I'm sleeping, you wake me up, give me a call. I'm facing this and this. I'll give you the support. He will give you the support. We have another team to give you the support. And we left Uganda specifically to start giving you the support. So after sales service, that the machine is here, it is active, all you need is to use it, and then we will come and handle the servicing and the after sales service. Okay? Yes. Just to give you a brief testimony about the first machine in the country, it is still under service. It started working in 2015. Up now it is still working. It is in Nakasero Hospital. It has not been replaced. It has not gotten any problem. They are only ordering for consumables and making calls. I'm not printing. What is happening? You find the cable is out of the equipment. Otherwise, the equipment, its origin is China, but it has stand the test of time. Its quality is reliable. So apart from other few challenges, you don't expect other noise, what? It has been, it has burnt, the machine is very hot, such kind of confiscated weird errors. Then, finally, this digital network that came is able to bridge that gap between you, the user, up to the factory. Believe me, within the first 12 working hours, you have the solution. That's how we do it. If I'm not active, maybe I'm traveling to Juba, and it's right time, I'm out of network. Timothy is on network, Bill is on network, Edwin is on network. The team is there, And we have other special team that is going to be available in Juba at Kalu. They will be able to drive physically, check, and then get you the services. Okay, installation conditions. You don't have to build the AC, you are simple lab. Get there at a space of half a meter by half a meter. Those are 50 centimeter by 50 centimeter. The machine will sit there. Just get a power source nearby. I mean electricity. That is enough. Okay, I will recommend a stabilizer because we don't know the performance of this power. Sometimes it's a generator. A stabilizer to have the machine protected because precious things are maintained at a given cost. Okay, you don't want to lose it over electricity because of power hikes. A stabilizer, that simple space. The machine is able to work standalone. But if you need quality things, because I mentioned the word VIP, someone will see these F4 results. Where are my results, please? Okay, the patient, as is bringing it, yes. You see, this is what I was describing before. The name of the patient and the details. Okay, that's the information that you feed in. I'm just putting there a yellow just for confidentiality. But that's how the F4 printout would look. If you want to connect it to the what? To the printer. So it will have that bar graph, and you see this top mark. Okay? Then this is the reference. If it is above this, so this patient was negative, okay? Because this is the highest mark. Now, if the results were exceeding this and crossing above 50, it would still go up to there, but the results will be positive, go down. The machine will show results, count 12, and gives a comment. But it leaves this for the doctor to endorse that these results have not been cooked from a computer, but it's a reliable medical practitioner. That's part of quality, by the way. Then finally, you have this. Above this is a greater than sign. Above this, positive. Below this, negative. But the conclusion is negative, okay? You'll have such a printout if you want to connect it to a printer. But still the machine has a simple printer, we call it a thermal printer. It's printing on a paper roll, the one you have on a hematology machine, okay? It's able to put information in there. It will print for around 10 centimeters, plug off, send it to the next department. In case you need a quick exchange of results, take this to this department. If there is an internal request for results. Others, the information is shared through telemedicine. You have a network within the hospital. You can send information via a computer, via email, via what. By the time you have your results, every department is able to access those results. So sometimes we handle it that way, and we have our installation like that. So it's an installation that you can expand or keep limited into one position. Okay. Quality control. We have this package that is running for 3 years. Once you have one, it will take you for a minimum of at least 2.5 years, because you have to leave that time of transportation from the place of manufacturing to the destination. So you are assured of at least, is it at least or at most? 2.5 years. You leave the other 5 months for shipping and manufacturing. It is a shelf life of 3 years. So the 3 years, you have what you call a background standard card. And we have what we call efficiency standard card. Now the background standard card, it is a patient of negative results. When you run this patient and the machine gives you positive results, just call me, just call Kalu, just access any immediate help, okay? So it's one control that will ever give you negative, okay? Then we have the efficiency standard card. This one is a patient of positive results. If you get negative results with this patient, then you contact the supplier, the manufacturer in our case. So for the readings, for every package, it has instructions that for this, actually let me check behind here. Okay. The standard card will have its count. This is now the count for this one is 930. That's it was manufactured and given the results 930. Now the description here says that plus or minus 10. No, plus or minus 30%. Any range plus or minus 30 within this. The results, first of all, they should be positive. Now, if the reading is below by 30% or above by 30%, it is still valid. Okay? So this is our the only two controls. They are not chemical, they are not liquid, they are not what. You only store this at room temperature. Every time you feel like you want to check the machine performance, push in. After 2 minutes, 3 minutes, you have the results that positive, negative. As long as it gives you reliable results with the standard cards, okay, then the machine is able to perform well. It's able to give you results. Apart from that, we'll give you the other technical maintenance. You see, you get my point? The training he talked about. Once you get the machine, you have to get one-on-one training, which is not so extensive. Bill, please come and take on this, the false positive and false negative. Then I'll come back for the APG.
All right, thank you so much. But before I take on the false positive, it was a concept. I would like to ask for someone in the congregation. You are showing us something here. We are having about greater or equal to 50 that is positive, and then less or equal to 40 that is negative. What happens to the 10?
Yes. Now, the machine will take the process of calculating the results or in analyzing the sample when you have inserted in the card. Okay? It has to make a decision whether positive or negative. So it takes 3 minutes analyzing the sample. After 3 minutes, it gives you results. But when those results are not produced, it will analyze again for the next 3 minutes. It can take 6 minutes now. Okay? If it has not decided, then it will give you the count itself. Then the count, if the count is below 40, it will put negative. If the count is above 50, it will say positive. But if the range is within that, it will do an analysis again to decide on where the sample falls. Thank you.
So the 10 is always trying to figure out is it positive, is it negative. Our machine has an AI which does that. It reruns the test without you pulling out the test card. This means there is no chance whereby the card that you're going to use will be misused. There is no chance of misuse. If you have followed everything that you have to do, which I'm about to talk about here, that what can cause a false positive or a false negative. Now, having a false positive or a false negative falls on both sides. The lab technician and the patient, the preparation, and then what are you doing during the test. For the lab technician, you have this patient, and they've come to test, and And then when you get the test card, this is your test card, you give it to them, and then you ask them to blow for 15 minutes. They followed all the instructions, and then you go ahead, get the test card, place it on a table, and leave it there. You are most likely going to have a false positive if you leave it there for a good while. I'll explain. Then, the other thing, you get the card, you remove this polythene covering, and yet you're not about to insert the card into the machine. You leave it out for a while. You are most likely going to get a false positive. Why? It's because this card detects carbon 14. Carbon 14 is not going to only come from your gut when you blow. It is in the air you breathe. It's there, okay? And this card is very sensitive to carbon 14, so it will absorb it. If it absorbs the carbon 14, it doesn't matter whatever the patient blew into this card, it will show you a positive. The machine will tell you that this patient is positive. So it was your error as a lab technician. Then, to the side of the patient, what can cause a false positive from the patient side? So you have this patient, you give them your card, tell them take the capsule, and after taking the capsule, sit there and blow for 15 minutes. Instead of blowing for 15 minutes, they blow for 30 minutes. Okay? They blow past 15 minutes, at least between a range of 3 to 5 minutes after 15 minutes. You will have a false positive. Okay? That is on the side of the patient. Then let's talk about the false negative. What can bring about the false negative? The false negative, it can be brought about factors like antibiotics and lifestyle. We are talking about the side of the patient, okay? Remember, let's say this patient has been on PPIs, they've been on antibiotics, trying to self-medicate themselves. And prior to the test, that means let's say between 2 to 5 days, they've used antibiotics and PPIs. And they were supposed to be positive. They will present, the machine will tell you that this patient is negative. Okay? Yes, that's on the side of the patient. You definitely tell you that this patient is negative. I've ever witnessed that one. And we had to, because this guy was presenting with everything, every symptom there is about PUD. And so we were trying to find out what is the cause, everything. He had it, he had every symptom. But we ran the test and the test came out negative, So the machine, we got this card, send it again. Still the same thing. We used the second card. We could just couldn't believe it. So until I just got this guy told me, okay, so talk to me. What happened? Say, I've been, these ulcers are too much. They are too much. Sometimes I cannot even walk. I'm just there. Say, like, so what do you use? Tell me, well, I use some drugs like that to cool it off. He said, when last did you use them? I used them 2 days ago. I say, hey, that's the issue. Little wonder we were getting a negative, but you were presenting with every symptom there is about you. So that's on the side of the patient. So what about on the side of the lab technician? What can bring about? Also on the side of the patient. I did talk about something I missed about the false positive. The empty gut. Okay? The empty gut. When you ask this patient to come when they fasted for at least 2 to 6 hours, then they come when they've eaten food, especially a diet that is rich in carbohydrates, very rich in carbohydrates, it will delay gut emptying. So when they swallow this capsule, okay, remember we have to get the carbon dioxide in the blood. So because there is food in the gut, it will delay gut emptying. It will delay the absorption of the carbon dioxide, the urea, in the blood. And then what you have? You have a false positive. Do you know why? It's because the H. pylori is not the only thing that is bringing about urinary concern. So now you are having this capsule stay in the gut for long. It is being acted upon by every other factor that is able to produce that is able to hydrolyze the urea. Okay, you're talking about the enzymes that exist in our blood. You're talking about other bacteria, everything. Okay, yes. So now, those are some of the factors. Have I left anything to do with the false negative?
We have a protective layer on the user. This one that you have to open. Okay? If you don't remove it, you get a negative. Because you are providing an insulation. In ionizing radiations, X-ray, CT, we put on a protective plate. That's down, okay? To prevent the ionizing radiations from going through to the body. Here, when you have this sheet, you'll be preventing the communication of the sensors to capture the information from this card. That will be a false negative. Hope I'm clear on that. Okay, if the patient is now breathing in through the mouth and breathing out through the mouth, what will happen? You will not collect the right sample into the sample collection card. Okay? You get that information. So if you don't have the sample, then what will the machine detect? A negative. There are some situations that I would get from you, the medics. Someone has no symptoms, but is showing positive. That is not a false positive. It is being caused by something else. Let's eliminate that out. If someone has no symptoms, is not complaining, but he has taken a sample, like when you get a volunteer, you have no symptoms, you have no any complaint, but you come out to be positive. It's not a false positive. No. It is because of other reasons that we are talking about. Okay, finally, ABG, arterial blood gas, or the blood gas analyzer. That's the technology that will also bring through our driver or the champion frontliner, Kalu, but it's a device that can be readily available with you, and the consumables are readily available with you. I cannot go into the details of the slides, how it performs, but it's a device also that has a cartridge, some people would call it a cassette. It's where when you collect your arterial blood gas, insert into that cassette, put it into the machine will analyze. It will not aspirate in any sample, but it will analyze the blood content and gives you results there and then in the ICU. Okay? So its performance, its details, what is the cost, it is something that we shall get through Kalu. But it's called HUBT Medical, made in the US. We have it in stock, we can, and then after sales services, we have the experts available to handle also the after sales services. So, if you are interested, please, you get back to our frontliners, they will get you the information and will come in touch with you. Thank you so much.
All right. Woo. Yeah, thank you so much. We had one last question. Allow me to do this very quick because now we are running out of time. One last question, and then we get to the vote of thanks. We have the representative from Kalu and from Rim as well. So, Martin, I give you a representative from the vote of thanks, and then thereafter we're going to have a speech from DFSCA, and finally we can call it a day. So very fast, Martin.
Well, thank you very much. As a vote of thanks, I am so humbled on behalf of our principals, Rima East Africa, and ourselves, Kalu Pharmaceutical Company Limited. We cannot thank you enough. I would request the team from Kalu to stand up and maybe come here for recognition. Flora and the team, please come for recognition. Don't say that it's only men in Kalu, please. The ladies are coming. The ladies are coming. This is the team. We have great men and women doing a tremendous job here in Kalu Pharmaceuticals. We have other teams that have remained at our areas of operation. Flora, please come. So what we have here is a team that has just represented the rest of the team that has stayed behind because we couldn't, the place needed to be operational. I would like Flora to do a very simple introduction. We just have 2 minutes. Just introduce one by one, very briefly, and then just
Okay, my name is Flora Michael. I'm the country representative of Kalu. Okay?
My name is Ate. I'm from Kalu. I'm a pharmacist, shop manager.
My name is Ivan. I'm from Kalu.
My name is Ethan from Kalu Finance.
Beleta Helen, Sales.
I'm Nelson Hussein, Sales Department.
My name is Salome Bobby.
So as I said, the team that is here is just to represent, to be available for the conference. We have a bigger team that has remained operational in the field and back at our warehouse, close to the showroom. We really thank you so much. I would like to introduce our director, maybe just by wave, Mr. Burhani. Yes, he's seated here with us. And the same Flora to represent him for that. We really thank you. I think we can go back. Thank you. Thank you so much. So, as I said, we are exceedingly happy. Thank you so much. You responded to our call. Of course, we had to go through protocol. We had to go through protocol, and by the time we got approval last week, we sent out the invitations. You responded positively, and we really thank you that you found time. This is the beginning of this project. We are going to reach out to you on your individual facilities, and we have further discussions with you. We thank the regulators, DFCA, we are really so humbled. You have supported us. Public Health Lab, you have really supported us in this because we can't do this without the regulator. As the representatives from Ministry of Health, we are really so humbled. You have given us your time, you have given us guidance, and we are still looking forward to further guidance to make this a reality. We had the question of where exactly Kalu is. Somebody said that I was supposed to be a teacher. I don't know, but I think I need to write. So we all know when you're coming from this side on Malekia, there is a road that goes down to a hospital called Freedom Hospital. Yes, we all know this road. You can either come through this road from up or you can slope from Malekia. So this road, on the side here, we shall find Kalu Pharmaceuticals. Here we have a sports center. It is called Malekia Sports Center. And for better directions, here we have Lukaku House. Now I know we have now seen. So we have Lukaku here. As you are coming, this side we have Neighbor Pharmacy. You see how I know Juba very well. So this side we have Neighbor Pharmacy. As you proceed, the next junction is the one that goes to Freedom Hospital. So before you slope, you will see us here. This is where our home is. Please find time and pay us a visit. We shall be so excited to see every one of you. I thank you so much. And I would like to extend my vote of thanks to Susan, who has been the engine besides this, and I would request her to come and connect. We need to use the small time that we have remained with. And Susan will help me to invite our regulators. First, we shall have the speech from the representative from Public Health Lab, and then finally, the representative from DFCA. I thank you so much. I look forward to seeing you again on such a wonderful platform. A video clip that has been prepared for our principals back in Uganda through Susan. That will be played here. It is just a 2-3 minutes clip. After that, then we shall be very good to go. I thank you so much.
The big drum sounds, the small one cannot. Please, 2 questions I found along the corridor. 1, if I have my sample, I want to carry my sample from ICU, theater, and then the machine is in lab, what happens? Bill, will I get a false negative? Okay. Here is a procedure to carry it. Make sure that there is no gaseous exchange between the environment and the card. Okay? So have a way of protecting the mouthpiece. Trap it, and with immediate effect, walk to the machine. Okay? As long as you reach it, insert it in. I found someone using a glove to arrest whatever that has been pumped by a patient, and then he was putting it in a special casing, moving it to the lab, and then he took his analysis. So please do not restrict yourself so much because you get a false negative. Have your breath trapped into the card and move there instantly. 2, the second question was, what happens if they have the radiation in the background? Won't that cause a false positive? The answer is no, because of the installation procedures we go through from time to time. We do what we call environmental adaptation of the machine. Once we run that background calibration, we call it calibration, the machine will consider whatever is in the background 0, and then only waits for the sample that you have introduced in. Thank you so much.
Thanks so much, Emma. There is no harm an institution having more than one equipment. It is happening in Nagasaki. They have 2 equipment. So if you think you can have more than 1 or 2, please get back to Kalu. Thank you. Protocol confirmed. Before I say anything, let's hear from the Human Resource Manager.
Hi everyone, I'm by the names of Yiga Sylvia. I'm the Director HR of RIMA East Africa Limited. I'm going to give brief overview of RIMA East Africa. RIMA East Africa was established as a company limited by shares to deal with the importation, distribution, supply of medical equipment, laboratory equipment, consumables, medical sundries and non-medical sundries, diagnostic kits, etc. RIMA East Africa Limited was incorporated in Uganda in the year 2008 by a team of experienced and dedicated professionals with expertise in health sector and in the medical field. RIMA has both full-time and part-time employees who are dedicated, experienced, and exhibit a high degree of professionalism, and these include pharmacists, biomedical engineers, procurement officers, accountants, marketers, to mention but a few. RIMA East Africa Limited works towards providing affordable, quality supplies and services to all our customers equitably and with passion. We do not compromise quality and price. We are time cautious and we value time as a resource. Thus, making delivery on time paramount. We make truthful representations as to performance of our products. We work to maintain our professional skills and those of our employees at the state of art. We conduct our business with honesty and integrity. We hold paramount sensitivity to health and safety of the public in the performance of our business. We are located at Rubaga Road, Access Building, Floor 247, or you can also reach us on 0772 432973 or 0774 646066 or 0702 982413, or you can email us on info@remaea.com or sylvia@remaea.com. Thank you for listening to me.
RIMA was given 6 countries to operate in. You can't be given even a single country if you've not produced the papers to qualify for. We are in Uganda, we are in Tanzania, we are in Southern Sudan. We are supposed to carry on in DRC, Burundi, and Rwanda. And from here, we are first checking on with Tanzania. We are given targets. The manufacturer knows Southern Sudan than you yourself. And that's how serious they are. If you don't put on an order, he threatens to take away the agentship. And in my records, I'll always be checking. Kalu is supposed to take 20,000 boxes. Why isn't he putting in an order? I check on my records. The customers I have back in Uganda have records. For example, if Nakasero has been taking 10 boxes a month, how come the whole of October they've not yet given me an order? Is there any problem? So for us, we don't just back the machine. We sit this side, we enjoy chicken and chips. No. However, we want your maximum cooperation. Please endeavor to pay in time. I don't know here how you behave, but some customers don't want to pay. They even take 90 days. I don't want to talk about the government, but back there, they can even take the whole year. When everything was delivered in proper arrangement, it is that money, we get something little, but it is basically capital. So we want that capital back. The manufacturer will not dispatch anything if it's not paid 100%. That means you need to have operational capital. So if I'm putting up a markup of a small profit, and you stay with that money for more than 90 days, really, you're affecting my capital because I'm not dealing in one product. So the way you open up your business and manage all those expenses, it's not only equipment, even the drugs where you get the drugs, kindly pay in time. Back there we have issues with the insurance company, sometimes they take long to pay. But get away, because if you pay them back, they will also pay, and you also pay the manufacturer. But for now, we have continuity. In Uganda, we've been managing. In Tanzania, they've been managing. Don't hesitate to take on this equipment. Thank you. I thank the management of G.M.E. Hotel. I don't know whether there's anyone here. They hosted us, they fed us, they've given us security, they picked us from the airport. You know, of recent, I showed Martin, there was an attack on a bus which was coming back to Uganda. And Martin, I'm not coming by road. In my early 20s, I still want life.
Oh my God.
And that takes me to the question. We can't inject a lot of money because we've injected in money here. And you just leave that project hanging. We will be on their case. And if you want consumables and machine, they will give it to you. A serious businessman can't do this and then he leaves it there. No, actually they are on task. My friend Mr. Burhan, Rolla, and Martin, you know, our case. We are going to be on your case. In business, actually it's business. So we thank you for honoring the invitation, and I know there were some challenges here and there. We always want to do what is right. It is not good for you, for someone to come from wherever and he comes here and says, stop, you've not done this and the other. Thank you, Mr. Brokane, the Kalu family. Thank you so much for honoring our proposals. I thank the RIMA team. We are six, we've come, 6 of us, 2 ladies, 2 young, 2 ladies, and 4 old men. Thank you so much. And we appreciate you presented. You poured out the maximum you can. Those who have presented, I thank you, Raymond, for the work. You need to justify the company's money. You need to take those photos. You need to take those videos. Thank you so much. For you, the participants, my brothers and my sisters, I can't thank you enough. You know you have a lot to do. Today is Saturday, some of you will be at church. Is there anyone who is an Adventist? They've all gone to the church. But you've left, maybe this time will be with your children, maybe in your businesses, but you've opted for this new technology. We don't take that for granted. Thank you so much. And we are appreciating your being here, and we don't take that for granted. Thank you, the administrators of Southern Sudan. Don't take care. Please, I'm urging you to, if possible, try to propose to the government. I don't know how it works here, but back in Uganda, don't take care from the government is supposed to be free, apart from a few cases, which is so serious. So this one is not just any other disease. We've been told the severity it can lead us to. I humbly beg you to pass this information. This literature has it all. Get tied. The leftovers, if you can take it to a friend, come. If you can maintain them, keep them. Provide. There is a lot of information here. All the chemistry and physics you see. You can internalize it at your own time. We can send more. We have it in a soft copy and everything that you need. You can't give out what you don't have. So, kindly give that information to whoever is not here and would love to have it. Thank you so much. Thank you for everybody. In case I missed out an MC or someone in particular, I'm not welcome against these dignitaries around here. Just forgive me. I'm not doing it on purpose. But thank you so much. We hope this is just the beginning. We hope by the end of the year, I have 100 machines in Juba alone. One. Yes. People always want to think that money is the factor, price is the factor. No. It is more than that. We need the technology, we need to give the proper diagnosis to the patient as they explain. I don't need to go back to that. We always want some local in our village. That clinic, they treated me, the disease which had defeated the other hospital. But what does that mean? You you've done an extra investigation, you've administered the right drugs, right? And we've got the holistic information, the diagnosis and the treatment. So thank you. Look forward. We offer a lot. As a matter of fact, we offer a lot. But our concern for today, and we do not want to mention anything, is Helicobacter H. pylori. Because it's rampant. The fact is, it is rampant. And since we are neighbors, it's like now the monkeypox. We are doing research as suppliers. If it is in Congo, and some cases neighboring Uganda, they are there in Kasese. Then we are doing research as suppliers, and as science, they are also doing research. I have a friend who's called Martin Mugeni. He did the research, he went to Congo. By then it's now 2 months. There were 104 cases of monkeypox. We are doing research. How can we be of use to the community? So in case such comes out, we are there. We just don't sit. I don't want to talk a lot, as women, since they brought us from behind. Then in Uganda, we talk too much than men. And now men nowadays actually have equal rights. Even buy food and pay house. So I don't want to talk much. We've had a lot, and we need to have a luncheon with my brother. Thank you so much. I now invite the FCA. Is it? Thank you so much.
Limited, all the other private clinics representative, and Kalu Pharmaceutical Company, and all the entire staff. I greet you all. My name is Helicobacter. I'm working with Drug and Food Control Authority, which is known as DFCA. DFCA is not well known in the country. DFCA is a regulatory body. It's a national regulatory body. It's to regulate all the pharmaceutical and medical products in the country. It's to regulate all the entry of medicine and medical products in the country. So, in Drug and Food Control Authority, we have like 5 most important departments. 5 departments. It's starting with the Department of Finance and Administration. We have also the Department of Inspection and Surveillance. We have the Department of Licensing and Registration, Department of Marketing Authorization, and the last Department of Quality Control. So, I think in the next project where Kalu are going to carry out in the country, they're going to work together with our Department of Quality Control. Some of our colleagues. I'm really so happy with the project, and I'm in love with it. I love what the guys say, the VIP. Yeah, I love that word. It's really very good to have a good diagnostic method, We have a problem diagnosis. When you have a good diagnosis, I think it will be very easier for you to cure the problem. Yeah. So this technology, I think it will really help in this country. And I would like to assure Kalu Pharmaceuticals that AFC will continue to work with you together, as you guys continue to bring in all the useful health projects to the country, which will benefit all the people of South Sudan. Thank you so much. And I think I will welcome my colleague from the Public Health Authority. Most welcome.
Thank you, colleagues. I'm really humbled to be in this important event. I just want to congratulate Kalu for the visit of the also for the partnership that you have made with our colleagues from Uganda between Rama company and Kalu company. That's a very good business venture that the two of these important companies in our area of field, that's a very wonderful thing. And for the technology that you have brought to the country, my colleague here has spoken about the importance of diagnosis. I would say when you have best diagnosis, you have best treatment. And it's a key for us. There is another key word that I found here, eradication. How will you indicate something if you don't diagnose? That's why this technology is going to help this country a lot. And it's not a VIP diagnosis tool, no, because any patient has a right to high quality test. Okay? So the next point is for Kalu, as Kalu is going to work with you. Affordability is key in business. You see around, you need to have memorandum of understanding with other business entities that are going to provide these services, so that at least for people in the country will have affordable services. So that's going to fall on your neck as the director of Kalu. And also for Kalu, Kalu is going to work with DFC, but also I will ask that the DFC and Kalu and Public Health Staff is to work together in terms of we have department for microbiology. That's a reference department. So it's good that the three entities collaborate to work together so that we can have at least data for post implementation of the project. Because we are not going to say that okay, the machine will just lie there. We are going to collect also those data and utilize those data so that we know the effectiveness of the machine. We know that the machine have worked in Uganda for close to 1 decade, I think. From 2015 is what I heard from my sister, 2015. So it's close to a decade. So it means that the machine is good. But at least in South Sudan, we need to also know about the machine. How is it good with our people? Yeah. So in other words, it's sort of like verifying the effectiveness, the efficiency, and all those important components in the country. At last, I will just thank my colleagues who came from different facilities. It's good that you came here to learn, to get knowledge. I'm also glad that I have very tremendous minds that have come from our brothers from Uganda. Wonderful, the two of you. I know that our colleagues here have gained a lot of knowledge. And it's congratulations for you, people who have came here. Because you have came to have knowledge. Knowledge is very important. People say knowledge is key and those kind of things. So it's key for you to understand the subject matter. So thank you, ladies and gentlemen. I'm going to stop here. And meet in the next events. Maybe you will be the one coming to us or we will be the one coming to you. Thank you, ladies and gentlemen.
All right, thank you so much. That was swift. Thank you so much. Three things. First thing is, if you've not registered, kindly do so at the entrance. And second thing is, You know, our dear friends here from Uganda brought us some gifts. Thank you so much. When they decided that each and every one of us is going home with a gift. Kindly don't leave. Yeah, clap for them, yeah? Thank you so much for being so mindful. Thank you so much. So at the door, while you're leaving for lunch, you take your gift there, and when you go, you can, share with your family members as well. Last thing is about a photo. We need to do a group photo outside, to celebrate what we've had today. You enjoyed? Yeah. All right. Yeah, thank you so much. So, Martin, do you have anything else to add? Come say something. From there, ladies and gentlemen, we just proceed for lunch. And I think
I learned something from our brothers from Nigeria. Any Nigerian here? A friend in Nigeria?
Yeah, me.
A Mukoto in Nigeria?
Not yet.
Yes, that we should always say something. When there is a gathering, we should always say something. So when she says anything to say, she challenges me. I continue to thank you. Please, let's have a group photo. It is arranged outside there. And we have taken note of the special message from the regulators. It is noted very well. And as a team, as a project, we are going to work with you to make sure that this happens. From the bottom of our hearts, we say thank you. We say shukran shadid.
all right, thank you so much. We can rise up kindly for a word of prayer as we head out. And my name is Elaine Mogambi, don't forget. Who was your moderator today? Who? I can't hear you. Elaine Mogambi. I host the breakfast show at Urban FM every Monday to Friday from 6 a.m. to 10 a.m. It's lovely. I would love to host some of you here, all of you here, okay? Feel free to visit us. We're located at High Welcome, opposite Save the Children. And on that note, I think we pray. Thank you, God, for this particular meeting that you've given us. Even as we head out, continue blessing us, be with us. In Jesus' name we pray. Amen. Thank you so much. Enjoy your lunch and remember your gifts.